and uh, the system totally how it works. You'll see today. Well, this is enterprise resource planning. Like for example, the healthcare industry generates a monumental amount of data. So that consists of patient medical records, analytics from medical devices, and administrative information, documents necessary for organizational processes and to practitioners. So all these things are there. So how can we manage all of these data? So we need some kind of tool. So that tool is called enterprise resource planning. So it's a kind of software. And moreover, no, these hospitals are looking out for digital solutions to conduct the financial, administrative, and clinical operations of the hospital. So there are largely they're carried out by means of a set of information informatics tools. These informatic tools collectively known as management software or hospital management software. So, in addition to a patient's healthcare information, inventory and personal data are also stored in this software, and that can be managed and transmitted across the hospital information system. Okay. So, this is a kind of integrated applications can be managed, and the business is automate many back office functions that is related to these technology or are working on this. So under this, we can say this electronic medical records. This is one of the separate set of things, specifically taking up all the informations about the patients. So now this how this ERP system is implemented. So you can see that the data is collected from different departments. The OPD means outpatient department, IPD means inpatient department, and the registration. Everything we have seen yesterday. This radiology and the pathology. Pathology is nothing but all blood testing tools, everything and all. So pharmacy, all other departments. So everyone is gives the data regarding the patients that will be collected and centralized. That will be stored in one particular centralized place. Even this electronic medical records also comes under this. Like it can also have all these components. Okay. These according to digital guardian. These systems include those that collect and store, manage, transmit patients' electronic medical records, hospital operational management systems, and the systems supporting healthcare policy decisions. They are all connected and communicated with each other through this hospital information system. So and it's it is extended to other areas also, not only within the patient's care or focus only on the patients. It is also extended to the services such as telemedicine and e-healthcare and intra departments like that. It is externally extended to other departments. These technological advances may it is also having the challenges because we are replacing this technology instead of paper based entries. And the main advantage of this electronic or digital what to get digital entry of all the informations, it can be easily accessible. The speed we can by click of the button we can get all the informations, and also it is very secure. We can safely keep that informations. Confidentiality can be maintained, so everything, because we can put a password or something it can be stored in some other CDs or in the DVDs, so that it will be specifically locked, or we can confidentiality can be maintained with this system. Now we'll see what are the different benefits from this hospital management system. Okay. So the first benefit or importance is asset tracking. It tracks expensive assets of the hospital and monitors how it will be used and prevent theft and reduce maintenance. See, asset means there are so many things. If you take the hospitals, no, the furnitures, that is also an asset, and the equipments, all diagnostic equipments, that is an asset, and operation theaters, surgical items, and medicines, uh, all these are all assets. So these assets are, some of the assets are very expensive. For example, an operation theater, those furnitures and surgical items and diagnostic equipment, CT scan, something like that. So they are all very costly. So when these costly instruments or equipments are there, that has to be monitored how it is being used, whether it is properly used. So what kind of, I mean, specialized or experts are I mean, appointed for utilizing or using that one or maintaining that one. So that will be I mean, monitored, and it also having the entry system so that it can prevent the theft, or in case if any repair has occurred in that system, so immediately that will be informed to the central technological people. They'll immediately attend and make it ready for the usage. So it will track all over the things, like whatever the assets that is present in the hospital, so that it can be properly used. Then lower inventory. There has been instances of inventory reduction by 40% to free your stock pile up and working capital. Inventory means like we have to make everything in the documentation. So in the case of paper documentation, you need bundles of papers and manpower, and each department it is like it is not having interlinking. So each department they will maintain their own inventories. So if you cannot know, you do not know what is going on in that particular department from the other departments. If at all you want to know, get to know the any information, so you have to go to that particular department and get to know, specifically asking for something. That will be, I mean, if at all in the paper inventory, then they have to search for the particular information. So instead of that, if at all we are making this hospital management system, it can be taken from, because all the departments are connected. So any inventory can be taken by clicking of a button. So that way it is reducing the percentage of things, the filing of the things, everything is reduced, and easy access of data, that is possible with this hospital management system. Then higher room utilization. It is like a patient checkout can be achieved in under 2 hours to allow the rooms to be allotted to others. So this is checkout means nothing but discharge. For example, a patient, the inpatients, they'll have maybe admitted for the treatment for a longer kind of treatments. So sometimes a patient may be admitted for a week or 15 days, or it may be extended to a month. So that depends upon the kind of ailment which they are having. So the treatment which they are taking up. So in that is the case, if any patient is get discharged, so immediately that will be informed to the registration counter, or the person who is in charge of all the patient's movements. They will collect all the data. So immediately they will work for the discharge, because the discharge process is very big process. So the consent doctor has to come and sign up the discharge sheet, because he has to give the authentication that the patient is cured enough, or he has to go for he can go to home and maintain or continue the medicine from the home itself. So everything has to be authenticated by the doctor. And apart from that, other departments, any experts or any diagnostic things are there, they'll also send all the bills whatever related to these patients. So everything is piled up, and that data will be go to the central data processing, where they will make it everything easy. So by clicking the name of the patients, they'll collect everything in one sheet or one window. So they will make it the discharge processes within 2 hours. So it will make it easy of patient discharge process. Then efficiency in billing. So that is what I am just saying about all-in-one integrated system for inpatient and outpatients billing. So here the billing is once the patient is registered, so from that point all the data will be stored, or it will be connected, interlinked. So everywhere, wherever the patient is moving to the consultant, the physician, then the pharmacy, if and all any diagnostic tools like radiology or pathology department, so radiation department, so like that, they wherever they are going and taking up the services, that will be sent to the central data processing, where from they'll make the cost and make the billing ready. So the fastest way of making the billing, so since it is integrated with all the system. Then effective marketing, the SMS integration to improve communication with patients, staff, doctors, suppliers, and other ecosystem partners. So this is like like all the apps nowadays, like with SMS. So whatever you want to communicate, you can communicate through short message services. So while registering all the data will be collected, like the patients and mobile number and contact numbers or WhatsApp numbers. So everything will be there with the hospitals. So after the discharge, also they can be in connection with the patients, or before that also some many offers are there in the hospitals that can be promoted through SMS. So all these things can be possible, or it is possible only through this hospital management system. So this improves the marketing. It is nowadays only not only the patients are, the inflow of the patients by the name of the hospitals, like how big and how the services are provided, overall the best doctors in that particular hospitals. So these can be promoted for better inflow of the patients. Apart from that, they are going for full body checkup. So this is a kind of a promotive activity or marketing activity. So they are, so many diagnostic instruments are utilized for this full healthcare checkup. So the hospital can give a compromised price or less price for doing this all health checkup. So in that way, they are attracting the patients to their hospitals. Once those patients are entering the hospitals, they'll come to know. So what are the facilities available in that hospital? So that way they'll come. They are promoting the hospitals and market their hospital facility to the public. So this is the another way of this hospital management system. So these are all the benefits. Now, what other things are going on with this, the hospital management system, that is streamline processes and reduce cost. This healthcare ecosystem is comprised of hospitals, specialists, pharmacies, clinics, etc., and each generating patients and facility specific informations. These informations, like the just a minute. These this is actually a central system. It is having the centralized system that connects all other departments. The info is fragmented, and it will not provide much value of patients and practitioners. So the centralized data system, no, this ensures, if at all it is not generating the centralized system, that is fragmented one. But if at all it is centralized, then it ensures seamless care by allowing healthcare providers to share information through like intra connective channels. So this connectivity improves analysis, diagnosis, and overall patient care. And implementing this hospital information system is additionally a cost efficient, because now the digitalizing process reduce waste and money spent on paper goods. So we have already discussed like how it's very difficult task of entering everything in the paper, and not only the entry is difficult, like retrieving the data, that is very difficult. No, when specific patients and data are specific billing is needed means we have to search so many files, it may be, I mean, filing system may be in a different way, like alphabetical way or numbering way or codes may be there. The registration numbers may be there. So they have to look out for the registration number or names. So there may be the chance of errors. The names may be repeating or the same name. The patients may have same names, only the initials may differ. So in that is a case, there is a possibility of errors. So that all these things will be reduced in this streamlining process, and not only that, cost also will get reduced. And then the manage patient medical records. So when we are, I said by EMR, electronic medical records. So this is very accurate patient record, and it is very critical for every hospitals and healthcare provider. A comprehensive system. It provides access to the patients, the medical records and histories in one centralized database. It can be accessed to these records enhances the practitioners' ability to provide accurate diagnosis. This electronic medical record is like I said, like it may be having the format, like what are the informations required from the patients. It also includes the previous history of medical history. For example, a patient is admitted for any ailment or any disease. So he may, before treatment, he may be asked for whether he has got any previous history, whether he has got diabetics, whether he has got cardiac problems, or any other problem he has faced earlier. So what kind of treatment he has been taken for those, and where he has taken the medications or the treatments. So how long he has been in the treatment. What is the present condition? Everything will be entered into this electronic medical record. So, this previous medical history also very important to treat the patients. So, everything is available in a single click, and everything available in one single entry. With this electronic records, they can get all the information, like specifically doctors, so that they can find out accurate diagnosis or what can be done to the patients. Then it increase the productivity and quality of service. So by utilizing the information by the doctors and nurses will improve the quality of the service which they can provide. Because no, by that, as I said, no, like by entering the name, so everything about that patient will get. So the speed at which their information they are getting, the doctors or nurses, that across the information, that helps improve their ability to provide optimal care. Then even they can address the issues in a timely manner, and they can create positive and the possible life saving experiences for the patients. So it is improving the productivity, also the quality of services. The quality of services is based on how accurate the diagnosis and how properly the treatment is taken place. See, unless otherwise, no, if the diagnosis is accurate, the treatment may go wrong. Uh, Nowadays, know that advancement in the technology and diagnostical tools. So the main exact ailments of the patients can be retrieved. It can be easy for the doctors to get all the information from the one click. So, in turn, it all produces the quality of the service. The accurate treatment can be done. See, for example, no, like there are some point, there is a mixed kind of diseases. So there may be the chance of going for treating one and ignoring the other. there is a mixed kind of ailments are there. So in that case, these tools can be utilized for proper services. And integrate hospital information system, that is based on the software. So there are so many management hospital management softwares are there. Based on the requirements of the hospitals, there are different types of hospitals. There are community hospital and maternity hospitals, and uh, only the pediatrics, only they'll so only they'll treat the children. That is called the pediatrics, children hospital. Otherwise, it may be called a children hospital. The hospitals are different. So based on the based on the types of hospital, the requirements of the management system will differ. So we cannot apply these technology generally to all the hospitals. No? There may be the basic ideas, basic tools may be there, but based on the service provided, there may be the customized. The software can be customized, or it can be improved, or they may take whatever is available in this information system. Well, we'll see that one by one. These are all the different things: core management, financial software, personal ERP, and medical documentation, asset tracking. Already we have seen the medical transportation management, all these things. If we take core management, the core system of the hospital or the hospital management system is an independent or cloud-based medical management framework. So this system captures and integrates the day-to-day activities of each department of the hospital system. This is the core management. So this consists of everything, and it connects all the departments. And moreover, it is the storage is cloud-based. Large amount of data can be stored in cloud-based storage system. So in that way, everything will be collected, and everything is collected day by day. Every day it will be collected. The activity is going on every day. That is a core management. Then the financial software. So the chief financial officer will be there in the hospital. They are responsible for the revenue cycle management, and they carry out the management and strategic planning through the software components. Uh, and the accounting softwares are there, and that will be used for the financial management, and plugins are there. So these are all the often in the interlink to form the overall financial management system. So with the proper monitoring of the healthcare organizations revenue cycle, the line can be enhanced, and resources can be freed up to speed on value enhancing operations. See, the finance is very important. No, like it should not go waste. So whatever the investments have been done, so it has been properly managed. Then only the profit or benefits will be get. So the financial officer will utilize this software, the financial software. So they'll having the balance sheets, and what are the expenditures are made, then what based on the expenditures, how it has been properly utilized. Whatever the expenditures properly used means like whether it is needed, then there is a the investment. Is simply we cannot invest the large amount, and we cannot waste the cost. So instead of that, they are look for whether it is need. So they'll have a committee, they'll have a meeting, they'll discuss about it, whether this investment will give any profit. Then they will go for an investment. So but that investment may be from the profit, or they may go for a loan from the bank. So it has to be managed properly. Otherwise, there may be the loss. So that is why the financial software that will be used, and the inflow of the finance will be checked out. Then personal or ERP, this is like patient and employee management tools. This is together taken care of the personal management capabilities of hospital information system. So these system know this facilitate transparent communication and then resource allocation and scheduling between the patients and medical staff across multiple facilities and departments. The major suppliers of ERP system in general are strategically considering the potential of healthcare to be relatively new and fast growing market. In this market, no, this market is very fast growing because this is this can be customized one. Here the patients and providers, healthcare providers will be connected, and the whatever the multiple facilities that has been provided will be connected. Inter departments are connected, and thereby it is producing a proper service. Then the medical communication, it is very important. Electronic health record or electronic medical record system that track patient appointments and care notes and financial information, and it's dedicated to documentation. No, like this framework must be in place in the overall hospital information system. And moreover, no, this helps ensures that all high priority documents from patients, records, personal details, inventory, hospital finances, etc. So these are all maintained across secure encrypted portals with proper access control. Mainly these patient details, it is confidential. No one should reveal what kind of ailment a patient is having to others, so that may affect the psychology of the patients, so it's very confidential. Unless otherwise it is required or legally it is required, none of these informations, patient informations, will be revealed to others. So it has to be secured in a proper way. So that is the reason they are making is this electronic health record or electronic medical records. It can be encrypted. Encrypted means unless otherwise you keep a password. I mean, input a password, it will not be open, or the data will open only in particular operating system. So in that way, we can encrypt the data. So that much confidentiality of the patient can be maintained. That is what actually the medical communication. Then asset tracking, we already have seen that what are the assets of the hospitals, how it can be tracked through monitored and used. So it's a inventory management system. Asset tracking is inventory management system. It can enable hospital staff to monitor inventory across the inventory life cycle, right from the purchase to compensation. See, when anything is getting inside the hospital or coming inside hospitals, unless otherwise something has been purchased, it is not having any entry to the hospital. So, like from the purchase to the compensation, so it has been monitored. When any item in the inventory, whether it is a pharmaceuticals or surgical tools in the brink of expiry. It can be replaced or stocked back up. It means it ensures the best practices followed in terms of inventory maintenance. So it is very important in the case of pharmacy. All the drugs are having the expiry dates. So after the expiry dates, the drug may not be potent, or it may produce any toxic effect. So the pharmacist should know the expiry date of the drugs or medicine or medications before the distribution of the drugs to the patients. So when this inventory system, when we are having this inventory system, by typing the name of the drug, so that will give the details whether it is expired or going to be expired. It is having the short period of expiration. So that can be given to the patients provided if the dosage is within that period of the time. So that way, the asset tracking will be utilizing or important for the pharmacies. It is not only the pharmacies, to other departments like other equipments which are all like having the wear and tear. So after that wear and tear, or the, for example, in the CT scan or any other radiological things that has got internal components that may lose after some point of time. So repeated usage of it. So the lamp or the other component will go off. So we have to replace that lamp or particular component that makes the working of this instrument. So these will be find out by this asset tracking. So that can be replaced. So that is the reason, like the time of purchase to the compensation means like utilizing and expiration and replacement. So the stocking, everything can be done with this asset tracking. Then medical transportation management. So it is required by what to say that based on the patient's medical appointments. There in the Western countries, there is a law that constitute the type of transportation takes place for the patients. Here, I don't think such a things are there. Only for the emergency or non-emergency. In based on that, we can say that the medical transportation. For example, like the ambulance usage. For government hospitals, there are free ambulance services that will transport the patients based on their conditions, or in the case of accident. So place of the accident to any nearest hospital that will be transported by these ambulances. And the ambulance itself, no, there are a variety of ambulance services. Some of the ambulances having the ICU, like intensive care, in the ambulance itself, until it reaches to the hospital. And so there are some other ambulances that is only mobilize patient from the place of the pickup to the hospitals. So this transportation management is one way it is promotive, the another way it is patient care, like giving the services to the patients. So that is medical transportation management. Okay. Well, types of hospital information system. There are so many types. So any hospital information system is very critical and improving the healthcare organizations bottom line, as well as providing more holistic and reliable patient care. So these are all the information system, EHR or EMR, and clinical information system, practice management software, clinical patient support. So all these things are different uh, information system. So any hospital information system is very crucial. Like for example, EHR or EMR can also exist interdependently. So, and as components of a large scale hospitals, no, like it may be interdependent. They maintain systemized collections of patients and health information in a digital format. In the format, maybe they are having it may be different based on it. Like this, it can be customized depending upon the hospitals. There need not be the same format utilized by all the hospitals. So each hospitals have got their own uniqueness. So they may include some of the formats, questionnaires that will be filled up. So that will give more informations related to the patients or related to the departments. So that the proper service can be provided. So this information, this digital format can vary. It is not the same for all the hospitals. I mean, if at all it is not customized, it will be same. Or based on the big hospitals, if at all a corporate hospital, they may go for customized format, digital format, as per their requirements. so that it may have a different kind of format. But basic informations, there are legally specific information should be there. Those informations will be common for all the EMR and EHR. Apart from that, they can improve uh, based on their requirements. The corporate hospital can include some of the points in the EHR and EMR. So, regardless of this type of healthcare setup, cash setting and the capacity of healthcare organization, these systems are implemented for patient information sharing. Additionally, they also help with easier consolidation of patient information to prepare charts and reports about general trends and the patient statistics. So this EHR, EMR, no, they'll have a statistical point also in this. Like uh, when the corporate hospital is there, the inflow of patients are there. There are different departments are there, like cardiology. The cardiology, how many patients have been admitted? So how many have been get cured enough? So these statistics will give their the quality service. So the inflow of the patients, as well as the number of patients cured, and that gives the kind of data. That data can be statistically interpreted to produce the proper informations, the result. So the organization, the hospital organization, they can utilize these data to improve further. If there is a lacuna, then they can patch up or rectify that, and so that they can improve their services, so that they'll get benefited, or profit can be seen by these hospitals. So this ultimately they'll go for all the data can be statistically put together to make where the needs or where the corrections has to be done. So that can be done by this. Then clinical information system. These clinical information systems are digital solutions made for automating the electronic data collection from monitors, ventilators, infusion pumps, filtration equipment, and cardiac assist devices, and so many things. So that comprises the everyday modern clinic of today. Uh, so you can see that in the corporate hospitals, no, when you enter into the ICU, no, you can find out so many monitors are there, so many equipments are connected with the patients. The instruments are connected with patients. One is showing the blood pressure or heartbeat and cardiographs. So another will give the lungs capacity, the oxygen intake, and what is the outflow, and what are other data, the infusion. I mean, if any medications is given to the patient, so it may be, I mean, like controlled weight may be given to the patients. So they can monitor per minute how much ml is been infused to the patients, and ventilators is for the provision of providing the oxygen to the patients. So oxygen should not be exceeded from the limit, then that will be very dangerous. So these in ventilators will give the monitor the inflow of the oxygen to the patients. So all these things will be there with the ICU. Would have seen that one. So this is the clinical information system. So these types of system can import or export data between medical instruments, and also allow the free flow of information across the systems. For example, no, like it can be accessed from the physician office. Every time there are like the advancement has been taken in that way, like the physician need not come to the ICU to see the things, or otherwise there are attendants, nursing attendants, they'll be appointed for each patient. They'll check all these monitoring system, and they'll note it down. If any changes in that, any deviations, that will be informed to the physician or doctors in charge. So they'll take care of what to do with the corrections and monitor things. So this is what the clinical information system and practice management software. Practice management system is a type of software that enhances uh, practice efficiency, personal satisfaction of doctors, and streamlined delivery of patient care. These type of software system usually manage the registration, scheduling, patient tracking, accounting, and reporting across a single managed workflow for all departments. A single platform is then enabled to collect payments of all patients' accounts. It's simply saying the practice management, but no, what to say, it is tracking the service provided to the patients by the doctors, attendants, and other supporting tools like diagnostics, everything. So this software connects each other, so doctors can come to know what kind of practice we are performing, whether his performance is good. The patients may give a feedback, or the treatment outcome may interpret what kind of practice or what kind of expertise doctors have done to that patients. So in that way, this is connecting the patients and doctors and other tools. And not only that, like from the registration and it can be tracked the patients. Where the patients have gone, like which department, like whether orthopedics or only general medicine, or whether they have gone to cardiologist or gynecologist. Uh, like that, they'll track the patients once after the registration. So not only that, then they'll make whatever the services provided to the patients that can be accounted. Like they'll make the billing. So in that way, they'll make it. So that way, the practice management software will help to monitor and track the patient from registration to proper service, and then accounts of the patients, billing of the patients, everything can be. Then clinical decision support system. This is clinical decision support tools are developed to assimilate large volumes of patients and treatment related data. uh, like clinics means like it is treatment based. So when there are population of the patient or more, so all these informations and whatever the treatment given to the patients, that can be stored as a data. The large amount of data can be stored. So these system then process these data, categorize them, and automate the suggestion of the next possible course of action for patients, treatment and diagnosis. They provide prompts and reminders to assist the implementation of evidence-based clinical guidance at care delivery. So, see, every information can be to improve the services by the hospitals and to reduce the errors. There should not be any error in the treatment. So, by utilizing all these advanced softwares and advanced technology and tools, we can minimize the errors. And see, if at all a large population of patients are treated, if any corporate hospitals, big hospitals, the inflow of patients are more, and their data will be stored, and those data is properly categorized. uh, they'll categorize that, and those data, there the software itself will make so many work that will categorize the patients based on their ailment, they'll categorize the kind of doctor services provided to them, kind of diagnostic services provided to them, and types of medications provided to them, and whether the complete healthcare services are provided to the patients, that can be retrieved or that can be interpreted from this clinical patient report system. So, with that, I conclude what are the importance and how it can be beneficial of all these informations and different tools, management softwares, hospital management softwares that will be utilized for the properly providing the services, the healthcare services to the patients. So it is all connected with data. So what kind of data we are collecting, and based on the data, no, like whenever any problem faced by the hospitals, then they can improve these data entries. Like they can include some of the things with this EMR or the EHR. So by that way, they can improve the total service provision of the hospitals. So it will uniquely make that hospitals services that may leads to the attracting so many patients, since they are providing good services, they are providing good care of the patients, they are making the patients satisfaction, and there are less errors, there may be nil error, the cost, I mean, effective. So all these things will cover attract patients to that particular hospital. So all these hospital information system can be utilized to attract the patients, thereby they improve the hospital profit or the management system. So once again, I thank all the listeners and friends for patient listening. I hope this covers how the hospital information system with different tools and management softwares, for the importance of utilizing this hospital information system. Thank you very much. We'll meet next class. What are the impacts of this hospital information system on teaching and learning, and continuing with any other topics. So I hope you got some kind of information. So I hope that covers the details. Thank you very much.
Thank you, Doctor. I think the Dean has said good morning to all of you. Am I audible? I am Dr. Sundaramurthy Reddy here. Hello. Good morning to all. Am I audible? Yeah, there is a slight change in today's program. Um, the director, Dr. Gopal, has asked me to take this hour. Today I'm in Bangalore. It is a Bangalore band because of Kaveri water issue, total band. I had my own doubt whether we get electricity, whether we get the Wi-Fi and all problems, but lucky I am having all the facility now. Let's quickly start. I put it in the group. My request to all of you is that a group created by the benefit of all of you. There are 129 people who are interested in MBA hospital management, out of which not even single person has seen what I have sent. Anybody has seen what I forwarded to in the group today? Shivaranji Madam, Ravi Shankar, Anjali Devi, Arunmuri, you can unmute yourself and answer. Any other person? There's a movie which is going to be released in USA. What is that, Lavanya, madam? I think I forward separated to you. It's about the vaccine, right? The movie is going to be. Yep. Yeah, I started, sir. Yeah, the same thing. Start content. Thank you. Just started. Thank you. Yeah. Am I audible, all of you? Vaccine war. That's what vaccine war is. Well, it's going to be released in USA. Along with that, I want to add every time some value-added information regarding healthcare, which is not there in the textbook. It can increase your knowledge, which may not be useful for exam purpose, but really in a knowledge-based society we are living. So in a knowledge-based society, we need to have our knowledge sharpened. So with my practical experience, spread over 40 years, I'm sharing it a couple of information with you. That's the reason they have selected a couple of seniors to address all of you. Okay, with this, today, I'm not going to use PPT, first of all. First of all, let us understand the subject. We have 8 units, right? 8 chapters. 8 chapters this week I'll complete it. Next week, I'll start reminding and revisiting unit wise with PPT so that it will be a double effect for you to understand the subject. The subject what I am going to direct it today is inventory control and material management. This contains in chapter 2 of your book. How many of you have gone through the book? I also put a message. Please scan through the book. Anyone who has really gone through at least what it is? Yeah, Ravi has raised a hand. Gone through. Nice. Yeah, welcome. I think all are listening. As I told you in the initial stage, when I underwent training in Switzerland for the body language as well as for listening skills, as you enter the class in the first hour, 8 or 9, you'll be totally tuned into the class. After 1 hour or 1 hour of listening, then your attention of listening goes slowly down. That's known as tune in and tune out. After 2-3 hours of continuous class, you are totally tuned out. That means you are physically present, mentally absent. So, how good you are at listening now? You're listening to a very important points which I'm going to explain to you on inventory control. And inventory control in management in hospital is a very important area because unless until you have a strong purchase department, nothing will move. As you know, you have the medicines, emergency medicines, you have the medicines to be used in different areas. The purchase department should have the inventory control at their disposal. That's the point which I'm going to touch upon initially, which is in the first paragraph of our book. So that should be done daily, number one, and it should be monitored daily, and it should be reviewed daily. Again, I repeat, it should be monitored daily. What is the medicine today we used? What is the medicine we needed for tomorrow? How many patients we have used? The parental form, the tablet form, whatever may be the forms of medicines are available. So it should be monitored very carefully. So with these few important words in inventory control, which plays a very important role in life-saving industry, which is the service industry, which is healthcare. Now, having said about service industry, what are the 7 P's which are important for service industry? You have studied a subject called services management, maybe second semester or third semester. Can you just tell me? I'm not developing amnesia. I do remember that, but somebody can join and tell me what are the difference between product marketing and services marketing. Anybody would like to volunteer? There is a difference, right? In product marketing, we have 4 P's: product, price, place, promotion. Whereas healthcare industry, is a service industry. Hospitality industry is a service industry. Aviation industry is a service industry. Education industry is a service industry. In this services marketing, you need three important P's which are added now from 4 P's to 7 P's. What are the three? Anybody else can try? It can go wrong. Nobody wants to participate in this. Okay, let me proceed with that. First P is the person, people involved. Next is the process. As I was just listening to Dr. Dean about the process of having the information in place, like hospital information in place. He has mentioned about hospital information, 4 different topics he has mentioned. So the process is very important. The people serving in the hospital is important. The process is important, and the appearance, physical evidence. These are the 3 P's which are very important for a good corporate hospital. I repeat, instead of the standard 4 P's, we have 3 P's to be added in the healthcare department because it comes under service industry. In service industry, the people who work there counts, the process which we have counts, like inventory control, materials management, movement of materials, storing of materials, everything counts. So this is a process. And appearance, physical evidence. Storage department should be neat and clean because we are playing with the lives of the innocent people. According to Dr. Jain Banerjee, who is the president of OPB, he says you cannot play with the lives of the innocent people by not storing the drugs in proper place. So inventory control talks much about the storage point of it also. So to sum up, inventory control in Unit 2 in the chapter, the book what has been given by the University DDE selectively talks about it's a life-saving department. It's a very strong department it should be, and the purchase department should have meetings daily, and there should be a regular interaction, and the steering committee should monitor what drugs we want, what drugs is needed, and how many we exhausted. So there should be inventory control system mechanism should work as per the daily monitoring system, which is very important. But moving on from inventory control, which I will take up later, maybe the next session tomorrow or the afternoon, say the role of material management is very important. There's a great book which has been given as a reference in a textbook, and some of you can lay hands on this online. Materials management. This is a book which is given, especially for engineering students. Materials management is given. So some of the departments, hospitals will have biomedical engineering department, purchase department. So they will take care of this materials management. But as a doctor, as a medical professional, as a paramedical professional, you should know what happens in materials management. The role of materials management, that's what is given in your textbook. It's plans the purchase of the product for that day. For example, today we are going to have a section of section of about 10 patients, say for delivery. We need to have the necessary medicines, emergency medicines, including syntocinon, methylgin, and neostigmine bromide. These are some of the ingredients we need the medicines, you know about it. In addition to that, the other rest of the things, is it available properly? Because from the database, as Dr. Dean was explaining in the earlier class, from the database, you know how many operations are scheduled for the day. Have we got enough medicines for that? Have we got enough stocks for that? And they've been stored properly in the proper place. Second point, and it's controlled by the materials management manager. These 3 points. You have planned your purchase for the day. You have second one is you have stored it in the right place, and inventory control has been properly monitored on a day-to-day basis. These are 3 important points which I thought I should discuss with you. Now, why this materials departments is very important. What are the department it coordinates? I'm sure some of you, most of you are working in the hospital. I'm sure, and you not talk much about it. First, it coordinates with the lab for clinical diagnosis. Materials department has to coordinate with the lab. It has to coordinate with the OT operation theatre. It has to coordinate with ICC, intensive care unit. It has to coordinate with the OPD, casualty. It has to coordinate with the scanning department, with the radiology or ultrasound, whatever it is, and it has to cooperate and coordinate with the specialty which is been wanted. Now we have now a lot of specialized surgeons have come now, including vascular surgery. Even the medical field is so much advanced. So you need to have whether the material department is in touch with specialty department, the lab, the OPD, the OT, the ICU, and the radiology department, the gastroenterology department, the gynecology department, the physiotherapy department, all the departments, name it in the hospital. So this uh, materials department has to coordinate. It's very clearly listed in your textbook. You can just scan through. I'm sure. One second. There's a call. Yes, madam. 1 minute. I'm once again, the call is from university. So I just okay, just text them. We're talking about materials department coordination. All these 11 to 12 departments of the hospital has to be coordinated with the materials department. Now, how the material management should function? The function is the material management. What are the characteristics of materials management function? There are 5 points which is very important. Number 1, materials management should be patient-centric. What exactly the patient needs, what set of medicines he needs, the quality medicines, and you have to check up the data of manufacturing, data of expiry, all these points has to be checked up. The patient-centric approach is very important in materials management, number 1 point. First point. The second point is the timing. When we want this product to be purchased, when the product has to be given to the patient, and when it has to move into different department, and what is the lead time it is taking is very important. Second point is time. First point is patient-centric. Second point is the timing. And for this, we have 2 technologies which are mentioned in the book, which I would like to take some time. I'm sure you would have studied human resource information system some time back. I'm sure you would have studied hospital information system, which just now Dean was explaining to you in the morning, hospital information system, right? For the movement of the drugs from the material department to different department, there are 2 important softwares and the systems are available of late, which will be very useful for you to check the movement of the drugs from department to department. The first one, which is known as MMIS, Materials Management System. Am I making clear to all of you? Any one of you can unmute and answer me. Ravi Shankar, am I clear? Yeah. In materials management, there are 2 important technology involved. One is known as, I just mentioned, MMIS, Materials Management Information System. The other one, the latest one which has come, one of my colleagues also got a doctorate in that from Pondicherry Engineering College, known as RFID. Don't bother, it's all in the textbook. If it's not in the textbook, I'll give you the notes, no problem about it. Just follow the lecture. RFID, that is Radio Frequency Identification Technology. By radio frequency, you can find out whether the drug has reached or not. So need not ring up and ask. The time based, and the technology can be used at least 2 technologies for materials management. One is MMIS, the next one is RFID, Radio Frequency Identification Technology. Then, third important point, the materials management should take care of is patient safety. Yesterday I was talking to you about when the drug is given, how it is moved, if it's broken, it's in the proper place, is it properly stored? All this has to be checked. The patient safety has to be taken. For that, you need to have quality. The quality management, which I just uh, mentioned, I think yesterday also I showed some. Yes, madam. Yes, madam. Yeah, 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 yeah. I've seen that. I've done it. I was just showing the book. Okay, thank you, thank you. Yeah, now we're clear. That's like that small error from my side. I regret for the inconvenience caused to you. I was just talking to you about two major technologies are used in materials management. One is known as MIS, the other one is RFID. The third point I was just talking about quality management, where I lost control for a few seconds, is quality. The quality management, if you have got a paper, please make a note of it. The father of quality management is known as Deming. DEMANG, Deming. He's the person who started talking about quality. You know, you can't compromise on quality of the drugs which are using. For that, I don't know how many of you know, I have seen a fact in the factory where Genticin, some of you must be knowing Genticin, which you use for parental form as well as eye drops, some time back. Anyone of you are aware of the drug Genticin? Okay, anything called Accusol A, vitamin A, parental form, or any medicine for that matter. Um, Please remember, these medicines are undergoing 35 different sorts of checks before it is being moved out of the factory. The quality check is done by the quality manager. So quality plays a very important role. What exactly is, because service in service, unless and until service industry, quality is assured, you will not get the patient back to your own hospital. No, they would say the service is bad. So quality is linked, correlated to service. So very, very important is quality of the product what you are giving. It cannot be a placebo. It should be a quality, active pharmaceutical ingredient, API should be there inside. So you have to check whether the ingredients mentioned and the packing and the product and the date of manufacturing, the date of expiry, and the storage point of view also cautions that were given. Top of it, the antidote in case of any adverse drug reaction, ADR, that also would have been mentioned on top of the package. I'm sure all of you would have heard about it and seen about it. You must have heard about it in pharmacology, you would have studied about it, and in not talk about it. So patient safety is the third point, which a materials manager should look into that. That is quality manager. Quality Demings. There is a one diagram which you can Google search and find out what you mean by quality management. It is known as QC7 circle, quality circle 7. Most of the hospitals will have quality department. They will meet regularly and check the quality lines up and parameters to be used. Like what we have in Teaching Institute, NAAC, NAC, and ISO certification for something. For hospital, we have ISO 14,000. In that, one of the conditions they see is the quality of the type of service you maintain, right from the product what you use, the way in which it moves, the way it's stored, everything is checked up in the quality department. The quality plays a very important role that's in the materials management. Uh, so in that, I will give you three important points. If you have a paper, please then make a note of it, which is not there in the textbook, but probably you can add this in the quality part of it. It is known as CPI, continuous process improvement. I repeat, continuous process improvement. What are the areas you can improve in a hospital? You can improve on the people who are doing service. People, the process, and the product what you're buying. Three P's. That's known as continuous process improvement. Total quality management consists of the very important point called CPI. Once you have the CPI into place, you get Six Sigma. That is the maximum number. Errors will be less. If you are going to use 1 million products in a hospital, that can be one error. That's only Six Sigma. Next stage of quality management is Six Sigma. If you can mention, when the question comes about quality, please mention within bracket the parameters used for quality management by the materials department will be CPI and Six Sigma. You can gather any information going to Wikipedia, Google search, or I can give you in the PowerPoint when I am going to present it next week when the classes are on, once we complete the 8 hours class of this week. So I mentioned about the patient-centric, I mentioned about the timings, I mentioned about the technology, I mentioned about the patient safety, and I also talked about quality. And the next important point for any purchase department should look into that is GMP. Any pharma company, any healthcare company, whether it's manufacturing devices, manufacturing products, manufacturing injectables should follow GMP. Can anybody help me out for explaining what is GMP? You would have studied in pharmacology. If you would have studied in physiology. Anybody can help me out in GMP? Expansion for GMP? One second, if you don't answer, then I'll answer. I'll give 1 second for you. Good manufacturing practices. Please mention that in the textbook or answer sheet in the exam. Good manufacturing practices. That should, yeah, somebody's, Yuvarani Shivakumar, you wanted to answer me that? There was a reaction from Yuvarani Shivakumar. Okay. If your answer is GMP is good manufacturing practices, that should be adopted and adopted mostly by all the pharma companies, and it should be ensured that the purchase manager checks all these good manufacturing practices are followed or not, and then only purchase these products. Okay. Example I have given the two important people who introduced the quality management in service sector. Since they come under service sector, hospital management come under service sector, Deming and Ishikawa. These are the two people which I forwarded in the group. I formed a group for all of you. The people things which I cannot share during your PCP contract program, I'll share it so that you can add it along with the points whatever you got in the textbook. Okay. Next important point what you have to see materials management people is about the cost. The cost of the product decides on the company which is we are getting it, the distance which also counts. Yesterday we saw in logistic management, supply from the place of origin to the place of consumption. A lot of things we have seen. So the cost has to be considered. So again, for the benefit of all of the beneficiaries, I have just repeat, materials management department should be patient-centric. Number one, it should know when the drugs are wanted. Timing is should be known. Then you have two important technology which are used. One is known as MIS and the other known as RFID. The third point is patient safety is important. For that, you need quality management. For quality management, I mentioned about two people who introduced in service industry the quality circle 7, which is known as two people, Demings and Ishikawa. These are people who introduced the quality management in pharma industry and healthcare industry. And we have used the word called CPI. continuous process improvement on people, process, and product. And we have also talked about good manufacturing practices. So far, we have discussed about these are the characteristic features of a purchase department, and we should also consider the cost factor. If we can write these 6 points in the answer sheet for a big part question, if it comes, I'm sure we'll be in a position to succeed, to get good marks. Okay. Now, having done this, next exercise will be what are the factors which contributes and controls this materials management system. You remember, in the first semester, we studied a subject called business environment. In that subject, first semester, first unit, you have considered two factors, external factors, internal factors, which can affect your business. All of you recall that? Anybody? In a big circle, first semester book, business environment book. External factors are not under control. Yeah, Deepthi has answered. Can you just, Deepthi can just type it out? What are the factors? External factors and internal factors, right? External factors are not under control. Internal factors are under control, if you can recall. So let's try to club it with what are the factors which can control the affect the purchase department. First, let me go through macro factors. Divide that into two areas, macro factors and micro factors. Very clearly, it is mentioned in our textbook, macro factors and micro factors. Macro factors, first, price trend. Price trend, yeah, this is correct. Deepthi is correctly put, is political, environmental, technological. Best we call that. Thank you, Deepthi, for your sharp reactions of remembering and cooperating. And this makes it more interesting when the interaction takes place between the participant and the resource person. It becomes very interactive. So macro factor, first point is price trends. Whenever you remember, let's take the example of COVID time. What exactly has happened, the price trends of during the COVID time? The COVID time, the price of oxygen cylinders have gone up, the gloves have gone up, the mask price have gone up, and things, everything, whatever you see, which was essential for the COVID treatment part of it, has gone up. We were to really, it was scary during the 2 years period, all of us have experienced. So the trend, price trend depends on the fluctuation of the demand of the particular product during the pandemic time. There are three words we used to use in medical management. One is pandemic, endemic. Third one, I leave it to you to filter. Pandemic, endemic. Third one. When it's spread across the world, epidemic, excellent. Ravi Shankar has given it. Epidemic, pandemic, and now when these three areas are happening, there will be a fluctuation in the price trend, right or wrong, accepted. So price trend is a factor which materials management has to consider. And the cycle of the particular product, right now, whenever you buy a product, business cycle, we say that. In new product development, you would have studied when a product is introduced, it growth is very high, then you have maturity period, then you are decline, new product development. You remember that NPD cycle. Like that, any drug which is introduced has got a business cycle, say for about 20 years or 15 years or 20 years. 25 years before, terramycin was the hot cake. Then came amoxicillin, then came ampicillin, then came so many products have come. Now we landed up in ceftriaxone season. There are first sulfas. I remember I was selling a drug called Madribon 30 years before. So the drugs have got a business cycle, like a product has got a business cycle, whether it is going to be useful at the current date or not. So he has to think about the business cycle of the product. And the most important point which a manager should know is the government policy. The government policy, who controls the price of all the drugs? There's a control system in the government, in India especially. You can't be selling the price of whatever you want. There is an order for that, known as DPCO, Drug Price Control Order. The government of India specifies that some of the drugs should not be sold beyond this rate. drug price control order. So the government policy of DPCO, it comes under the Drug Control of India. Most of the commonly used drugs cannot be overcharged. One classic example, sorry, one classic example I can tell you. I'm sure all of us been using omeprazole. Omeprazole was sold some time back per tablet more than 2 rupees or 3 rupees. The prices have been slashed. Omis from Dr. Reddy's laboratories. Because Government of India immediately said the price has to be sold at this. Now, I'm not commenting, I'm not supporting any government. I'm not into the political arena, but the present government has started a new pharmacy where the cost of the price of the drugs are available 40% cheaper than the other shop. Anybody can name the scheme which was presented by the present government, Modi? The many schemes is announced. Since you are in the healthcare and pharma industry, and since you are in the inventory management of the product, those who are from Pondicherry, you can mention one is in Laspet on the airport road, one is opposite to in the 45 feet road. In Tamil, they say Makkal Marundam. In Hindi, they say Jan Aushadhi. Have you heard about it? Anyone? You have all the drugs available at 40-50% less expensive than the branded ones. It's all available in generics. Have you heard about it? Have you visited that? Anybody from Pondicherry? Last area, you can see this is now more than 2,000 shops are open now. So the cost factor, Jan Aushadhi, yes. Diana Shamila is correct. Diana Shamila, you are from which part? You are from Pondicherry, right? Yeah.
Yes, sir. Government hospital. Yes, sir.
Yeah, Diana? Yeah, I couldn't hear you. Yes, please.
Government hospital, sir. GH.
Yeah. So this Jan Aushadhi, I'm sure, quite popular now, right? It is being
Yes, sir.
40-50% less. So the government policies can have an impact on the purchase of drugs, right or wrong? I told you two. One is the DPCO, Drug Price Control Order. Drugs cannot be sold at exorbitant price, so the government is looking into that and they control the price. That's not DPCO order. It is not there in the textbook. Please mention in and the macro factors which comes in your book. Within bracket, you've got a piece of paper mentioned DPCO, the Drug Price Control Order controls the macro factor, government policy, where you can mention within bracket Jan Aushadhi. It's the latest one. So you cannot see it in the textbook. And then the credit policy of the manufacturer. Suppose you give it on credit, so people will buy it and sell it. But some people, they have a system called C&C, cash and carry. These 2 points are not the textbook, but I'm adding it to you as a value addition. One is known as credit policy. In that there are 2 factors. They give you credit and collect the money after 1 month after selling the drug. The other one is you give the cash and carry the drug. They will not give you credit. We will not give credit. The company where I was working will not give credit. It's C&C, cash and carry. So this is what is the credit policy. It's a macro factor. So coming back to the macro factors, I list out again for all the benefit of all the people. One is price trending, business cycle, the government policy, the DPCO order, the credit policy, and the trends in healthcare system. Now, the trends in healthcare system is that now most of the companies have started outsourcing the manufacture of the product to newer places like Himachal Pradesh, Arunachal Pradesh, and other areas where the government gives a lot of subsidy. So they try to utilize those benefits and try to manufacture the product and get it done, manufactured by other companies, keeping good quality, good manufacturing practices, and get it done for the very reasonable price, and the benefit is passed on to the customer, that is end user, that is the hospital, in turn to the patient. These are the macro factors. Having done the macro factors, then you have to think of the opposite of macro is micro. What are the micro factors which a manager, what you call the manager or material manager, should think of? you should think of inventory utilization. How much of drugs we are buying, how much we are using it in this month, how much is a spillover for the next month. I'm sure yesterday I used a word called just in time. Just in time is a Japanese management philosophy where you get the drugs which are only useful and can remain in the shelf for 10 or 15 days. You don't dump the drug and keep it for months together. So just in policy or inventory utility point is one of the major micro point which materials managers should think of inventory management point. Second, some of the drugs can be rejected mainly because while transit, it can be broken, it can be spillover, it may be label may be spoiled. So all these factors has to be seen. So there should be a rejection by the materials manager of the products which are spoiled or broken. The strips are crushed. You would have known, no, unhygienically it's packed and things like that. So the third point, which micro factor, which is the lead time. The time you place the order, the time it comes to your hospital. That's the lead time. And the important point which materials manager should see is the storage. The fifth important point is storage. So I have classified the responsibility of the managers, purchase managers, or what you call materials managers into two categories, macro factors and micro factors. I discussed these points very clearly and very simply in a systematic way. The Pondicherry University DD has kindly put it in a very systematic way for you to understand. And before we close the session, before we ask some questions, I have one important point. The standard procedure for purchase of a drug is a flow chart. I think you can tell me, how do you buy a drug? Diana can help you out. She is, and where is Ravi Shankar? Is suddenly gone. Lavanya, can you help me out? You are there. There's a standard procedure for buying a drug. What is that? You tried. First, you have to create a purchase request. It happens in any place. You have to send a purchase request. We want this drug, purchase request. And then immediately, once you create a purchase request, what it does, it converts into which company you have to buy. You select a company. There may be competitors, right? You select a company. First, create a request. Second, select a company. Third, estimate what will be the cost of the purchase. How much is going to cost by buying, let's say, 10 strips or 20 strips or 20 vials or 20 ampules. So you have to estimate the cost of that. Then submit the whole thing to the finance department and get their approval. Submission of the cost to the finance department or the CEO or the RMO, depending on the type of the organization structure they have in the hospital. You have to study the organization structure in the first unit again. You have SBU, MBO, MBE, matrix structure, flat structure, management by walking around. All this I need not talk much about the organization structure. I'm sure you, as mature students in the final semester, will be knowing the organization structure. And in matrix structure, you have HR manager, finance manager, production manager, materials manager. All these people are there in matrix. Whereas in single man show, it's only the CEO or MS who decides on this. So depending on the organizational structure, the standard purchase process takes place. So you submit the estimate, get the approval, and talk to the company. Look, I'm going to buy it. It's known as bulk quantity discount. I'm sure you would have experienced it. When you want to buy it in bulk, the company extends a certain amount of incentive to you, or a bonus to you, or free offers to you, which can cut down the cost of the product, and the benefit can be passed on to the patient, or the benefit can be passed on to the management, either. So this is known as quantity discount and quality discount. Two types of discounts are available. You can negotiate. And then finally, you conclude of buying which product, which company. So 7 steps. First, create a request. Then select the company from where you're going to buy it. Estimate the cost for that. Then submit the cost plan to the finance department or to the management, whichever is available there. And then you negotiate with the company, we are finalized on getting approval, get a quantity discount or a quality discount, and then you close the order and place the order in written form or mail and or over phone, or nowadays we have got online purchase or some of the drugs are available now, so you can think of it, right? This is what is today's my lesson plan for you for the first 50 minutes. I repeat what I have discussed today. Carefully listen to me. First, I discuss about inventory control. Inventory control is the nerve bone of any hospital, right? It's a very, very strong department. It's service department. Service department depends on three important points. That is people, process, and physical evidence. People are important, process is important, and appearance of the storage point of view is also important. Since we are in service industry, healthcare comes in the service industry, customer delight or satisfaction, patient delight is a very important aspect. So inventory control, you should contain all these three. And we have taken up materials managers and material management for today's class. Part of it. I have not completed, I'll complete it tomorrow. So in the role of the material manager is about forecast and store and inventory control. And what are the different department management, the materials management supports? It supports OPD, casualty, ICCU, then gynecology, optometry, whatever it is, you name the department, 14 to 15, including the emergency department, it caters. So the materials manager is a nerve center for all the departments working in the hospital. Please remember, if you can mention this, put a chart, flow chart, the responsibility of materials management in a hospital to various departments. Put an arrow and put all these. It's been clearly written in a textbook. You could have gone through it. Right. Now, next one is what I discussed was material management's. What are the points you should follow? You should follow 5 points. One, he should be patient centric. He should have the timing sense in his mind. There are two technology involved in that. One is known as MMIS, which I told you, Materials Management System. Next one is RFID. Then patient safety is important. Safety means quality. Quality means Deming. Deming means we talked about Ishikawa, and then we talked about some of the examples, and we talked about CPI, continuous process improvement on the people, process, and the product, whatever we are trying to do in the hospital. So this will help you out in getting good repetition in the marketplace. The last point is cost. This is what the materials manager has to consider. Now there are some factors which influence the manager. One is known as macro factors, the other is known as micro factors, right? Macro factors, which I mentioned, is the price trend. Example we are given about during the COVID time by how we faced, and the business cycle in the new product development, the government policies, DPCO, Jan Aushadhi, we talked about it, and we have the trends in healthcare system. Now we can slowly, healthcare system is getting a lot of importance. In my research, which I have done about 15 years back in healthcare and hospital management, the reach of the healthcare in India and the insurance part, medical insurance part, was not even 4%. The longevity of men were only age was 59 and women were 52. Today, after the completion of research, when I see the report of WHO, the longevity of men, people living longer, the average man's life is 79 and average woman's life is around 69. Average I'm talking about. So quality of life has gone up because of the healthcare service providers. We contribute for the healthcare system, which is part of the essential part of a life. So we have discussed about macro factors and micro factors. And finally, before we leave, we have talked about standard process of purchasing a product by material manager. That is, first, purchase request. Second is select the company. Third is estimate the cost. Fourth is submit the estimated cost to the management, get the approval, and then negotiate to the company from where you are buying so that you can get a discount, a bulk discount, a quantity discount, whatever may be that, and some free offers. And you conclude your order placing method. I think with this, I will call it today. There's one more subject which I thought I can and talk about this. I think we talked about it completely. If you can permit me, 2 minutes. the principles of purchasing system. Six principles which I spoke on the initial day. First day I told. Right quantity, right quantity, and the right time, the right source, for the right price, and from the right place. All right. The 5 rights. Right quantity, right time, right source, and for a right price and a right place. These are the principles of purchasing system, which is to be followed by all of you. Okay. So, thank you very much for patiently listening to me. Now I have got 3 minutes time to give it to you for any clarification. Anybody? Shiva Ranjani, Kamalini Natarajan has not participated. Varani Shivakumar and Lavanya Sri, Anjali Devi, Diana has participated. Sir, can you explain about reverse logistics? Logistics, I think we can take it up for tomorrow. That is there in the first unit itself. I have not touched upon. Okay, we will take it up because the time is not even 3 minutes. It will take 10 minutes for me to explain. Yeah, it's a good point to make a note of it. I will take it up in the next class, reverse logic. Other than that, all of you received the study material. Madam Mahalakshmi, have you received the study material? Have you gone through the textbook? How many units are there? Okay. Yeah. How many of you really touch your heart and tell me you've gone through the textbook? The management, the directors have taken the, I think Nivedita Madam has taken the pains of sending it to you by courier. They cost so much of money to you. I'm sure, please, tomorrow when we attend the class, please go through chapter 3. You have conveniently, the university has divided into 8 sections. And you want a good mark. Okay, if you are thorough with 6 units, you will be getting above 60. Now, one case study which I have mentioned is about pump being purchased, especially for orthopedic pain. It's there in this second unit, which I have not discussed for want of time. Probably case study we will discuss it during some other time. So I request all of you to go through the study material. Come, prepare to ask questions. See, this PCP program is not a program where we have to give lecture. If I can understand, when we started about 25 years back, you have to ask questions. We went through the book. We have some doubt on that. That's the way we used to explain. Now things have gone ulta. You want PPT, you want the important questions, you want which page the answer is there, and you want the textbook, and you want 5 years question papers. But we are trying to help you with all these facilities, right? Am I right? To make things easy for you, because most of you are working and you will have little time to go through that, but see that this 15 days or 12 days when we have the contract program, the same day you refer. For example, today I took class on unit 2, lesson 2. Just scan through that. You can see the macro factor, micro factor, you can see the technology, everything. You feel still you want the PPT, I can give you. My talk is always extempore. But I will give the PPT at the end of the program. Maybe after 3 units or 4 units, I'll just send it in a group. Will that be all right for all of you? You can just type it and endorse it. Those who are available. Which one? Ravi, you want PPT before the class or after the class? Or while the class is on? Excellent. Whenever you give the PPT after the class, that will be useful for you, because at least basically you have understood. I follow the system. I have my own system. Each faculty has got different system. I follow the system. After the class, yes. How many of you, Lavanya, madam, going through the group? Today I have sent this one great movie about it. After the class, yes, thank you. Most of you endorse after the class, yes. Now, after the class, you want this to be put it in the group, or you want it to be again explained? Let me clarify that also. Group is okay. Group. Excellent. So that makes things easy for you and me. At least you'll open the group. Today, surprisingly, none of you opened the group. I put that movie and the essence of it. Only I think Lavanya madam has responded to that first, the group. Okay. I have today this man from Vellore is missing. He's missing, I think. Thank you all, Diana, Lavanya, Vedita, and all participating in my program. Thanks a lot. Bye then. Thank you.
Friends, so should we start this? Hello, can one respond? You are able to see the screen? Okay, thank you. You are able to see the screen or not? Friends, thank you very much. And today is the third day for me. And accreditation is a quality assurance procedure. And when we know a hospital is accredited, we understand that it has got at least the minimum facilities, minimum standards as specified in the standard manual of that particular organization, which gives the accreditation. In India, we have agency NABH. So there are many other agencies are also there, but not in India, but in other countries. So how this NABH is different? How this NABH is different from other accrediting agency? The hospital standards are accredited by International Society for Quality in Healthcare. That means whatever the standards specified, they are internationally recognized. Whatever the standards specified are internationally recognized. And the government approval, because this is given by NABH, and NABH is the component of or a constituent of Quality Council of India. That means is a government agency. Is a government agency, and when we have accreditation from the government agency, it has much better value than other agencies. Look at this works under the Ministry of Commerce. Quality Council of India is the constituent body, as it is an autonomous body which works under the Ministry of Commerce. This is not only just works, it is supported by many other ministries like Health Ministry, Health and Family Welfare, Ministry of Tourism. They all support the certification of NABH. So NABH accreditation not only for these allopathic hospitals, it has the provision for accrediting our Indian system. Indian system are Ayurvedic, Siddha, Unani, and partly homeopathy also. So we don't call them as traditional medicine. We call them as traditional medicine when it is outside the country. Any procedures, any system that we have adopted from outside, then we call it maybe traditional. But other people, including WHO, they call it as traditional medicine. But when it is India, it is India's indigenous medicine. Ayurvedic, Siddha, and Unani are India's indigenous medicines. We don't call it traditional medicine. There is some problem. I'm coming back again, opening the file. See here how NABH is different from others. The first one, if we look at, the standards are designed, the standard NABH standards are designed to facilitate understanding and implementation. The cost of investment is much lower than other accrediting agency. Cost of the whole process of accreditation is much higher in other accreditation bodies. See here how much it costs for NABH application fee for up to 100 beds. It is only 40,000, and annual fee is 1,65,000, and virtual assessment fee is 3,000 plus GST. And even for a hospital like where the bed capacity is more than 501, application fee is 1,50,000, annual fee is 4,40,000, and virtual assessment fee is 15,000 plus. So that means this we say it is worth investing in accreditation process because this is not very high and this is applicable even in the Indian context. So it has been realized that there is a requirement to create awareness to the patient. That is what the patient safety day, and to improve the patient safety, we have to go for accreditation. And patient safety is the primary requirement of the accreditation process because patients are the customers of hospitals and customer satisfaction. I'll call you back. And customer satisfaction is the first requirement of quality management. So why we go for accreditation? Who are the stakeholders of accreditation of hospitals? Patients, the people who are working, health workforce, the organization itself, and the paying or insurance agency. Nowadays, you might have seen Everywhere we have the insurance system. Even in the government, we have the insurance system. Some states have their own insurance system. Central government has a system. So all the stakeholders of accreditation, no, all the stakeholders of the hospital, healthcare delivering institution, all the stakeholders of the institution benefited from the accreditation process. So we'll see each stakeholders, as I said earlier, to the consumers or the patients are the most important clients of the hospital. If consumers are satisfied, if the patients are satisfied, the hospital will flourish. If the patients are not satisfied, the hospital may be able to sustain, but it cannot flourish. So, what way the consumers get benefited? Consumer is assured of quality and patient care. So the patients are comfortable now because they know where they are going, quality care is available, and they give priority to the patient care. Service is provided. Service is provided by trained and qualified medical and other staff. So that means credentialed. So when you say these medical and other staff have the credential, that means they are qualified. So when we say is legally acceptable qualification, legally acceptable qualification, and when it is not legally acceptable qualification, they are not credible staff. So legally qualified health professionals are involved in providing service. So this is the comfort a consumer gets. Right of the patient. Yes, the hospital or the healthcare organization respect the rights of the patient. And not only they respect, they do also protect the rights of the patient. Patient have the right to raise a complaint, and there is a provision for continuously taking the feedback from the patient, and these feedback are monitored and they are implemented too. There is a system of audits. So the whole process, the way the hospital works, everything is audited, starting from the facility to the procedure, the work is all audited. Availability of SOP. SOP means standard operating procedure. Everything they do, there is a written procedure. That means whoever is staff providing the service, whoever is the doctor providing the service, whoever the surgeon providing some, whoever the laboratory technician, for everything, every operation, there is a standard operating procedure so that the service will be uniformly provided irrespective of who is providing the service. So, what are the benefits to the organization? Why the hospitals are interested to go for accreditation? Because it provides opportunity for continuous improvement. So during audit and all, we'll find where are the lacuna, and that means there is a procedure for improving the service every time. It demonstrates the quality of the care and patient. So that means when hospital claims that we provide quality care, we provide the patient safety as a priority, how will one will know? So this is what the organization claims. Yes, we have the accreditation. So that means this all accreditation process will provide confidence to the public, confidence to the consumers, confidence to the patients who are coming to get the service from the hospital. Opportunity to benchmark. Yes, the hospital changes its benchmark. The quality is something which requires updating. There is technological advancement, and with the advancement of technology, the quality benchmark also improved. So the hospitals periodically provides the benchmark, improves the benchmark of their services. And the most important for a hospital in the private sector, that we require lot of patients to come. If the patients are coming, our beds are filled up, the hospitals can earn a good revenue. That means they get an advantage over others, that our hospital is better than others. So more people will come for healthcare to their hospital. Once the hospital is accredited, it gets international recognition. Friends, for last several years, we have seen the medical tourism has flourished in this country. People from many other countries come to India for treatment. And there was a situation when people from America also was coming to treatment to India when hepatitis C when hepatitis C medicine was discovered maybe 5 years back. When hepatitis C, there was no treatment. One company came out with a treatment, and that treatment was costing 1,000 US dollar per tablet. Just imagine, 1,000 US dollar per pill. And the American insurance companies said, no, we cannot afford to offer this treatment. And since hepatitis B or other hepatitis, we have a vaccination and other programs to prevent hepatitis C, we do not have. So this medicine was the only medicine available for treatment, and the treatment cost was 1,000 US dollar per tablet, and 1 month treatment is required. So this was, but India at that time, Indian government permitted the manufacturing of this particular medicine in spite of it is under patent protection. In patent protection, we have a relaxation that country can overrule the protection offered by the patenting process. But this overriding as a rider. This is only for use by the patients. It cannot be exported. So many people, even from America, they came for hepatitis C treatment to India. All other countries are regularly coming people, especially the African countries and other countries. They are coming regularly, but this was the situation when for hepatitis C treatment they were coming. And it is easy for the insurance company to empanel this particular hospital. Yes, you know, even we have the Prime Minister's insurance Yojana, or the some state like Orissa, there is a Biju Swasthya Yojana. The government gives this money for treatment. So this insurance, when the government has to empanel which hospital is should go for treatment, yes, government can tell, yes, these are the hospitals which are accredited. Private, there is no issue. But if even for the government, even nowadays, even private also issues, because they say is how this hospital is empaneled for treatment when it does not have the facility. They say yes, this hospital has facility. That is why they are in our panel list. The staff who are working, starting from the medical staff to the other staff who are working, there is an opportunity for them for continuous learning, good working environment, and good leadership. See, when we have continuous learning, good working environment, and there is a good leadership, so people who have worked in those hospitals, they will have also demand to go to other hospitals. That is a problem. So, you know, that gives a good feeling that the staffs who are working have a good feeling. Improve competencies and efficiencies. Yes, they are continuously trained. And continuously trained means they'll improve the competence. What is competence? We sometimes we have a misunderstanding. We have a erroneous understanding of competencies, and we say is that is why we have three terminology: KAP. KAP. K stands for knowledge, A stands for attitude, P stands for the way they are working. KAP. And if we follow this KAP, if we understand the KAP of the people who are working, we have both knowledge, attitude, and practice. So these three put together, knowledge, attitude, and practice. This all three together, if you put, we say the people are competent. And now, everywhere we are talking of competency based curriculum. So, even our MBBS curriculum, they have revised to make it acceptable in the changing world. Means the people who are coming out of this program, they will be competent. So that is why they say is competency based curriculum. And the people who are working here, they will also have efficiency because they are continuously trained, and also continuously they have to improve their performance. So what we see is there is an overall professional development, and the people who are working, they get this opportunity. Insurance agencies, they have which hospital they should empanel. Yes, this is an accredited hospital. So this accredited hospital can be empaneled because the quality assured stamp is given. So others do not know what is inside. But since the hospital is accredited, there is a reliable, certified reliable information on facilities, infrastructure, level of care. So they will say that if you go to these hospitals which are tied up with our insurance companies, you will get a quality care. See, how do we evaluate in a hospital? How do we evaluate in a hospital? So based on its performance. So how we assess this performance? So here are few indicators. It's not complete, but some of the very important indicators. First indicator is time taken to initial assessment of indoor patients. Time taken for initial assessment of, that means what is the meaning of time taken? When we are time start the assessment of the patient and when we complete. So that means if you take long time, people get frustrated. So that is why it is an indicator. It is an indicator. Another indicator is number of reporting errors. Number of reporting errors per 1000 investigation. How many errors are provided? We say we document, yes, there is an error, I'm documenting. There is maybe another person we said, no error occurs. That may be out of fear or out of why peers will look at, oh, I commit so many mistakes. Sometimes we hide our mistakes. We do not disclose the errors we have committed. But there must be have a system for reporting. And this is one of the criteria indicated. Percentage of adherence to the safety precautions. So, lot of safety issues are there, even in diagnosis. Okay, even the simple issue comes, needle prick error. Whether we have a system, what to do, whether we have an SOP, all these things, whether we have. whether we follow this. Even if somewhere, if you see some hospitals, they don't wear the gloves. They just come, put the needle in your artery vein and take out the blood. Some hospitals will find they all will be wearing gloves. They are using even the uh, antiseptics or the alcohol. There is also a sterilizer. They will use it. First clean your place, from where they will take the blood sample. So how many people are adhering to this practice? So what percentage of adherence? Medication error rate. If it is a preventable event, whether all precautions are taken to prevent. In spite of that, to error is human. There is possibility of error. So what percentage of error are occurring? So whether they have the procedures to avoid abbreviations, which abbreviations may not be properly understood by others. Even the other day we have discussed the discharge medications summary was misinterpreted because the abbreviations used did not properly understood by the health professional who was discharging the patient. Percentage of inpatients, percentage of inpatients developing adverse drug reactions. Friends, this is very easy to understand and accept. Yes, all medicines have adverse effects, possibility of adverse effect. No medicine is free of, but when it comes to the individual, why should I be the victim of the adverse drug reaction? Yes, the medicines may have the adverse reaction, fine, but why should I be the victim? But it has all sometimes happen. That is why either we have the procedure, to manage this adverse drug reaction. So what here indicated is what percentage of people are developing. That means if we have good number of adverse drug reaction events, there is possibility that these people are trained for managing these adverse drug reactions. If there is no adverse drug reaction earlier occurred, we do not know what to do. That is why sometimes we say, how many years of experience you have? Somebody will say, I have 20 years, 30 years of experience. Friends, if you teach a parrot to recite every morning Ram Ram or something, Krishna Krishna or something like that, does it mean that he got a spiritual experience? So that is why the experience meaning is how many times we face the adverse situation. How many times we face the adverse situation. That adverse situation will tell us how competent we are to manage such situation. How many times or what percentage of patients return to OT unplanned? That means something has happened. Something has happened. So more something happening, it is not a good sign. Percentage of surgeries where organization procedure to prevent adverse event like wrong side, wrong patient. Percentage of transfusion reactions. So many times we give the transfusion, not necessarily always the blood transfusion. Sometimes we have the transfusion of our large volume parenterals like glucose injection, sodium chloride injections. We also give, and they also causes problem. But many times we find after giving transfusion of simple normal saline, the patient developed high temperature or fever. But vigilance is only regarding the blood transfusion or blood components transfusion that decides. And we have adverse drug monitoring system in this country. We also have hemovigilance. We also have vigilance, something like. So, what is the mortality ratio in ICU? How many people are dying in ICU? We understand ICU very critical patient, but what percentage of the patients are dying? What percentage of people are returning to emergency department? What percentage of people are returning to emergency department after discharge? And this should be within 72 hours, means 3 days. Within 3 days of discharge, how many people are coming back or reporting back? What is the incidence of hospital associated pressure ulcer? Incidence of hospital associated pressure ulcer. When the patient is lying on the bed for a long time, the patient develops ulcers. And what is the incidence? We have two terminology. I said earlier also, we have two terminology. We call it prevalence. Prevalence means that has been occurring, and incidence is means new things are happening. New things are happening. Catheter associated urinary tract infection rate in whenever we have given catheter to the patient, there is every possibility of the urinary tract infection, and one must be careful about it. So these are all the performance indicators. Ventilator associated with pneumonia. So ventilators, people who are seriously, we give ventilator, and how many people suffer from pneumonia. So suffering pneumonia rate. Central line associated bloodstream infection. There is when the patients are in the hospital, there is a possibility of bloodstream infection also. And this bloodstream infection, what is the rate? That is one of the indicators. There are other indicators. These are surgical site infection rate. Surgical, that is why we sometimes call it clean care is the best care. So surgical site, yes, surgery is done and infection is. So what percentage it is coming? And hygiene compliance. So whether all people are washing their hands prior to touching a patient or doing any procedure. Percentage of patient receiving appropriate prophylactic antibiotics. Percentage of rescheduling of surgery. Yes, we have planned surgery, but for any reason it's not done. How many times it has happened in the hospital? Percentage of rescheduling of surgery. Turnaround time for issue of blood or blood components. Yes, the doctor wants that I want the blood. How much time the blood bank takes to give this blood. So these are all some of the indicators. What is the nurse patient ratio in ICU? See, in ICU, even patient caregivers like relatives are not permitted. They want to go, but many times hospital refuse, no, you can't go and see. We get annoyed. They're not allowing us. Friends, frankly speaking, nobody should enter other than the authorized people to ICU, because more we enter, more chances of creating problem to the patient. ICU patients are already serious, and more we enter, more chances of infecting them. Waiting time for outpatient consultation. I have reported for consultation. When my consultation will be over, this is called the time required for outstation consultation. That means we have to look at the time we report and coming out of the consultation room. Friends, this is even one of the criteria used for any hospital. First criteria, how long it takes. We are afraid of going to the hospital because we have to wait for longer. And sometimes when we are waiting for longer, the doctor may see only just few minutes, especially in the public hospitals because of high volume of patients. How long it takes to get our reports, diagnostics. Yes, we have given the blood. When I'll get the hemoglobin report, when I'll get other reports, how much time it takes to discharge, percentage of medical records with incomplete or improper consent. That means that will show us indicators whether there is system to document every procedures. If a system does not document, that shows there is lacuna in the quality. Yes, medicines, we have different types of medicines, vital, essential, non-essential, but which are used in emergency means vital medicines, either they are going stock outs, out of stock. If there is out of stock, they have to rush. Yes, a patient is come. There is no medication available. One has to rush to the pharmacy to get this. So stock outright. Number of variation of the, you know, if everywhere, either people are prepared. So for that, mock drill is conducted. Even mock drill, you might have seen outside sometimes the life-saving organization like fire brigade, the fire station, they do the mock drilling. When we see people nowadays is disaster management people, they do mock drilling. So that is, and during this mock drilling procedures, how much we deviate from the standard procedures. Patient fall rate. This is a very, very important area. Nobody creates problem. Patients sometimes fall in their bathroom. Patient fall from the bed, and either the environment or the facility prevent the falling of the patient. So that rate also will tell us about the quality of care. Many events it could have happened, but we have just on time we have intervened. It did not happen. So how many are there? What percentage of near misses? Incidents of needle stick injury. So how many times this is happening? Then handing over, no, as far our Indian laws are concerned, the maximum duty period is 8 hours. And when one doctor is leaving, when one nurse is leaving, one pharmacist is leaving, whether there is an appropriate handover, handing over is done. And whether the patient, doctors write medication in capital letters. So these are some of the quality indicators. So before we close, one more. Here is a question for you. This question is regarding the, Kon Manega Kororpati. Wow, it's a very popular program. And here is a question for you. To know how confident you are, if it is written 2024, we have 4 A, B, C, D. Which one is correct? Which one is correct? 2024. It's written 4 ways. and which one is correct. Which one is correct? So please think of, and we'll come back after lunch and we'll join at 2 p.m. So can we come back at 2 p.m.? Hello. Friends, just before going for lunch, I gave you a simple questions, something what normally we see, Kon Monega Krodpati, there are options. So similarly, here we have a confusing answers, all looks equally correct. So what should be? And that is usually we see in the minds of the people, and especially when they want to go for hospital for medical treatment, or when they go for children's education, which college to choose. And like that, many times we have the confusion, and all this confusion makes us further confused. We ask our friends, we ask relatives, we ask teachers, and so many people. But ultimately, it does not give you a satisfied answer. So, when such confusion comes, only one answer that gives us some satisfaction is either the institution is accredited or not, either the organization is accredited. So similar is in the healthcare developing or healthcare providing institution, whether the healthcare institution is accredited or not. Friends, who is important in accreditation? Yes, accreditation ensures us, but who is important in the accreditation? Look at this picture. There are three persons. There are three persons. So who is important? First person, second person. They are just standing. They are not doing any work. But the work is done by the third person, fitting the AC. But he cannot do this work unless these two persons stand there and keep a balance of the platform in which the individual is standing and working. So similarly, who is important? Who is important? Everybody is important. Everybody is important in accreditation. So it is a team work. Accreditation is a teamwork, and all members need to work for achieving the goals of accreditation. Goals of accreditation is ensure that ours is an institution which has all the quality parameters. We achieved all the quality parameters, and we are now ready for assessment. So, what is accreditation? Is a quality assurance procedure. Accreditation is a quality assurance procedure, and quality cannot be assessed at the end. Procedure is over. Now we want to say quality. No, quality cannot be assessed at the end. Quality is to be built into the product. Quality is to be built into the process. So whatever we do, that must be of quality. Then we say we can achieve the quality. And very difficult to define quality. Even very difficult to define quality, because quality, there is no uniform definition. But usually we say if it satisfies the requirement of the customer, we say the quality is achieved. But at the same time, it not only satisfy the requirement of the customer, we also need to see is that the whole use of that material or the use of that procedure does not harm the individual. So that means not only the we look into the quality of service, but we also look at that it does not harm the individual, and that is what is patient safety. If we can assure that our system has this, then we call it is quality assured. Quality assured, and assurance of quality, that we mean it is quality aspects. If we ensure that product and procedures that are followed looks into the or produces ensures the quality in every place, then we say it is a quality assurance procedure. So initially, if we look at, initially we talk of quality control, but now we go a step ahead, the quality assurance. It is not just the quality control. So there may be many laboratories. You say it is it is a quality control laboratory, but quality control laboratory cannot assure the quality. Quality control laboratory looks at the quality of a product or a procedure which is already done, which is already done. So quality control cannot ensure. So every step in the quality process is to be assured, and that is the whole total of the procedure is called quality assurance. See, this is our NABH. What is NABH? Once again, I repeat, what is National Accreditation Board? National Accreditation Board for hospitals and healthcare providers. Remember, friends, National Accreditation Board for hospitals and healthcare providers. So, as I said, this is an autonomous body under the Quality Council of India. Recently, NIBH has celebrated World Patient Safety Day, that was on 17th September of this month. So if you see here, it has 18,000 plus hospitals and healthcare providers, which they have already accredited or partnered. How many accredited? 3,600 plus. How many are certified? 10,800 plus. And assessment credit is 4,200. And how many countries? Yes, NABH is not only for India, there are other countries also. It provides the accreditation. So that is why so much value of NABH accreditation. So when we talk of quality of health services, we have moved from the Millennium Development Goals that we have framed. Millennium Development Goal in 2000 for 15 years time period was given, 2000 to 2015, and 2001 to 2015. Within this 15 year, all the governments, not only the government of India, all the governments, because this was the goal fixed by the United Nations Millennium Development Goal. So what they wanted is to make the world better, make the world better. So on the beginning of the millennium, they fixed the goal, Millennium Development Goals. Yes, something we have achieved, something we could not achieve. So they started telling, so 2015, towards the end, we have framed another category of goals. This is called Sustainable Development Goals. And these goals that we have achieved or plan to achieve, rather, our target date is 2030. Many things probably you might have, even when we had G20 meeting, they also talked about how far we have progressed in the sustainable development goals. The ultimate outcome, what we want to achieve as far as health is concerned, direct health. So many indirect health also are there, like environmental health. Environmental health influences our health, but not directly. So achieving UHC. UHC is universal health coverage. That means everybody should get the health care what one requires. Friends, the corona has taught us a beautiful lesson to the humankind. What is the lesson? If I am okay, everything is okay. No. I should be okay, my neighbor should be okay, all others should be okay. Then only, because there is no barrier for the diseases. No barrier for them. And India has taught to many others. We have seen people are greeting each other through handshake. But India has told Namaskaram is the best way of greeting others, and which has been practiced even by other countries, at least during Corona, because Corona we cannot go close to the other person. 6 feet distance is to be maintained, but we can do our Namaskar from away also. So that is probably the healthiest way of greetings that India has taught to the others. So what we want is universal health coverage. When universal health coverage, it is both preventive and the curative. And now we are going beyond that, that is called public health, not the individual, but public. That means all of us need to be healthy. But can we define what it means? Whether we can talk, if somebody is asked, are you healthy? I'm sure he or she will think before telling yes or no. So optimum health care cannot be delivered by ensuring coexistence of infrastructure, medical supplies, and healthcare providers. Three important things in healthcare: infrastructure, medical supplies, and healthcare. But that alone cannot provide. If we have the infrastructure, we can provide to some extent. If we have medical supply, we can provide some extent. If we have healthcare providers, we can provide. But the total quality of care is not possible by simply ensuring we need a total orientation of all the requirements, infrastructure, medical supply, and the healthcare put together. So, what is the meaning of quality healthcare? The degree to which health services, remember, all these days we are talking of individuals. Now we are talking of population. So that means it is not that individual is okay is enough. We are talking everybody should be okay. That is what we are talking of the public health. Some examples of quality issues, what we have seen, what we have seen reported. Friends, sometimes we tell whatever reported in newspaper, either they are correct or not. That is why one philosopher has said, what he said? He said, if you don't read newspapers, if you don't read newspapers, you are uninformed. But if you read newspapers, you are misinformed. So whatever we see in the press, all are not correct. One should have our own judgment. And all this probably we can see only publication in reputed journals. Newspapers are very often misleading. Adherence to the so this means the study is done. Adherence to the clinical practice guidelines in 8 low and medium income countries. It has been studied. Normally now they don't call poor countries or rich countries. They termed as low income countries, middle income countries, and high income countries. So it shows 50% in several instances. Adherence is only 50% or is below 50% rather. That means what we saw from the study has shown us there is low quality antenatal and child care and deficient in family planning services. The service delivery indicators, if we look, 7 low and middle income countries, significant variation in service. So what we see many times provider are absent. Daily productivity is lost by the patient. There is no diagnostic accuracy. You can see the accuracy is only 34 to 72%, and adherence to the guideline is only 22. Friends, when we talk of all these things, that shows how perfectly we do our work. Yes, we are in different place. Someday we will be the health care providers and being the management students, you may be in managing the healthcare institution, and you must look at these are the issues. There are plenty, and as far as quality is concerned, we always look that quality seats should be available to the last man in the line. Systematic review of 80 studies shows that suboptimal clinical practice is common in both private and public primary healthcare facilities. OECD says, Organization for Economic Cooperation and Development, India is not a member of OECD completely, but it is in partnership with OECD. This data shows high and middle income countries, there are 90 to 53% women between the age of 50 to 69 did not receive mammography screening, and 27 to 73% of the older adults age above did not receive the influenza vaccine. So this is all an average data from the OECD study. The better health outcome is possible through improvement in quality. So high quality health service should be made available. That means right care at the right patient. Sorry, right care at the right time, responding to the user's needs and preferences while minimizing harm and resources. See, right care, right time, right patient, and at right price, so that we can achieve high quality. Quality healthcare increases the likelihood of desired health outcome. Quality care increases the likelihood of health outcomes. Friends, we talk of quality. If the quality we cannot measure, it is not a quality. What is not measurable has no meaning. So that is why the 7 measurable characteristics are made to assess the quality: effectiveness, safety, people-centeredness, timeliness, equity, integration of care, and efficiency. These are 7 measurable characteristics which are used to assess the quality. If not measurable, that parameter is not at all excellent. Earlier it was not like that. So quality mechanism is to be built into the health system. So you can see here 5 fundamental elements delivering the quality. These are healthcare workers. That means healthcare workers not only be qualified, they should be competent. Healthcare facilities, we have the best facilities, but we also know how to utilize these facilities. Facilities allowed will not, but facilities, availability of facilities are the first requirement. Next, how to utilize these facilities comes next. Medicines or the medical devices or other technologies, they should be available, and there should be a good information system. And last but not the least, perhaps often the most important, is finance. So if all these things are available, probably we can say we can provide quality services. Ensure high quality workforce, ensure excellence across the healthcare facilities, save and effective use of medicine devices, effective use of health information system, and develop the financing mechanism to support the service. So these are some of the interventions that can be used. Changing the clinical practice. What has been done earlier with changing science and technology, either we have changed our clinical practice, fixing the standards, and engaging and empowering the patient. Earlier, patients are kept in the dark. Now, either it is serious matter or not serious matter, everything should be told to the patient. If patient is not told, or its caregiver is not told about the issues involved in treatment, it is a failure in service. So there should be a quality improvement programs, method, and all these things should be inbuilt into the system. In addition to that, it must satisfy the requirement of legislation and regulation of the country. Not only of the country, sometimes, for example, at the outbreak of dengue, every dengue patient is in that area, the hospital needs to inform the authorities. Now, see the TB, HIV, all these patients, when they are treated, they should be informed to the local authorities. This is all for the notified disease. So we must satisfy the requirement. Another important sharing of lesson learned. Whatever we have done, very good. But if somebody has done better, either we know that, either we can follow that. So we can share our good practices with others, and we adopt the good practices of others. This is one of the requirement of accreditation. So all good practices which have been practiced, results have been seen, it must be shared with others. What the government should do? National policy, demonstrate accountability, ensure that reforms, what it is the part of the government who has to do. Close the gap between the actual and achievable performance, establish a sustained healthcare purchase fund, allocation of finance, all these things are on the government. So what the system should do? Health system. We should sometimes calling is implement evidence-based interventions. Evidence-based. It is not experience-based. A doctor says, I have 30 years of experience. But what happened? There may be possibility a patient comes once and never comes back again second time. So that is also an experience. So that is why we don't go by the by experience based, but by evidence based. Evidence based practice should be introduced. Benchmark should be updated periodically. Ensure that all people with chronic disease, their quality of life is not compromised. The promote of the culture system and practice should be improved so that we can reduce the harm to the patient. Build resilience to prevent, detect, response all the health related issues. Put in infrastructure in place, technical assistance, everything should be made available. So, what you I can do as a citizen or a patient should do. Be empowered to actively engage in the care, play a leading role, be informed what is the right of the patient, and also how to receive support, information, skill, everything we should be aware of. Participate in quality measurement and improvement. This is what the health workers should do. They should participate in quality measurement, embrace the practice of philosophy of teamwork, treat patients as partners, accept them as partners in the delivery of care, commit themselves for providing and using the data which are effective and safe. While no single actor is able to affect all these changes, an integrated approach is necessary. So, if we look at the quality of care, quality of health care, we have effectiveness, efficiency, integration, equity, and all together can provide the quality of healthcare. If you see here some data of 2015, burden of disease, low income countries 38% is burden, high income countries 18%, upper middle income countries 19%, lower middle income countries 20%. So this is how our disease burden. Primary care, starting from the Alma Mater Declaration to Asthana Declaration, and now is our G20 Declaration. Everywhere we are talking of strengthening the primary care. If the primary care is strengthened, the health of the country can be improved. And whatever the healthcare, it should be people centered. So, empowering and engaging the people, strengthening governance, reorienting model of the coordination, all together can lead to a better care. Friends, the last slide I would like to share with you, and please feel free to discuss anything which is you are able to understand, which you are not able to understand, or you have doubt, you have confusion, whatever you have, please feel free to share. The chat box is through which you can write your data questions, because I'll be able to look at, and as far as possible, I should be able to share with you. See, it is a question and answer session, so please feel free. I have few questions. You should be able to understand what is quality assurance, what are the critical areas, what is accreditation, does accreditation ensure quality? One of our member was asking yesterday why we have so many authorities, so many qualities, ISO, NABH, JCI, and so which one we should follow, which one we should not follow, and what is the benefit of this? Every authority gives some ideas, and as far as India is concerned, if we have the NABH accreditation, it is acceptable to all in the country. So I'll just repeat quality, how do we define it? And the quality is obligatory. That both implied quality and obligatory qualities parameters, the healthcare institutions should be able to provide. Quality assurance is the total process, whole process which ensures quality, that is called quality assurance. So every organization should have quality assurance department or mechanism at least. So what are the critical areas where people are main materials and methods? Any quality, main materials and methods. These are to be looked at. Accreditation is a self-assessment and external peer review process. So we do both self-assessment, the individual. That is why most of the time, whenever there is an accreditation, they are first asked to submit the self-assessment report. Even accreditation for education and institution, we say self-study report, SSR. So self-assessment report then will be followed by external peer review. So the experts will come to look at your facilities. Accreditation assessment. Accreditation assessment means it is an evaluation process. The evaluation process is a long process. It's not starting from your documents to physical verification of facilities and practice together constitute the assessment. Yes, a question is, does accreditation ensure quality? Yes. It doesn't mean that accreditation institution has no quality issues. Accreditation institution also has quality issues. But when we don't know anything about that, but this stamp of accreditation ensures us, yes, this is a quality organization. Why so many authorities? We have ISO and MBA, we had JSI. Someone asking whether, yes, JSI is not for India, but if one wants to have JSI, accreditation can take. So JSI accreditation, especially for the developed countries, of the developed countries. Friends, if you see about the quality, quality varies. The quality of even the materials we see, anything we see, the quality varies based on our affordability. Yes, it is quality, but if this quality is not affordable, that quality is of no much use. So that is why India has developed its own system, NABH accreditation, which we can design what an quality council has designed, that this is our requirement. This is our requirement. If we require, if we satisfy these requirements, we can provide the NABS certification. So now please open yes, NABS guidebook is available in its website. NABS guidebook is available in its website and it is free. It is free. Even some of the parameters NABS had just, it is in the draft in 2023. Some of the parameters they want to improve. This is only draft. It is not yet implemented. Anything, please feel free. Okay, thank you, every one of you, for your patience hearing. And if you feel anything to be asked, later also you can email me. I've already shared my email. Thank you very much. So, welcome. Namaskaram. Good luck.
sorry, class இருக்கு. Good afternoon, everybody. Can you hear me? Good afternoon, everybody.
Yes, sir. Good afternoon.
Yeah. So I hope, because I'm sharing my screen, I may not be visible because of this restriction. So I'm going to share my screen alone now. So I hope only I got response from one respondent or one person. So good afternoon to all. Can you hear me?
Good afternoon, sir.
Yeah, good afternoon. So some more. Yeah, okay. I'm getting response from a message. So okay, well, okay. Thank you. So let me introduce myself. I'm Dr. Noorul Alam, working as associate professor in pharmacy in Mahadrasa Postgraduate and Research Institute of Health Sciences, which is a government of Kocheri institution. Okay, I'm first of all, I congratulate and welcome you all for this lecture, and congratulate for taking this a wonderful course called as MBA Hospital Management, where you'll be getting a wide opening and even extra opportunities and even other other opportunities also. So welcome you all. So with this, I will share my slides. So my slides are visible. Anyone can reply, please.
Yes, sir.
My slides are, yeah, thank you. So, okay. So now we are going to see the fifth chapter called facilities engineering. So what is facility engineering? First of all, why this topic in the MBA management or in a hospital management? Why this topic? Actually, you can see the slides. We can see a healthcare team. You can see almost all the persons. Can see doctors, physicians, a pharmacist, and even with X-ray report, radiologist, and you can see everyone. So, is it only these people constitute the healthcare team or healthcare providers? Anyone? Anyone beyond that? For a proper healthcare? Can anyone respond? You can see almost all the persons who constitute the healthcare team. So apart from these people or this group of people, any other people are there responsible for a healthcare, a proper healthcare providing? Anyone? So anyone can respond so that it will
It's
be more
biomedical.
interactive. Yeah,
Yes,
okay,
biomedical.
biomedical. Yeah, biomedical engineers. And so any other people? Any other people who are important for a good health or health providing or good health providing team or for health maintenance in a hospital?
Plumber electrician.
Pardon,
Facility
sir?
manager, sir. Facility manager.
Okay, because of this
Facility.
topic, facility manager, we got easily the facility engineer. Okay, very good. Actually, these people are
Even
behind
plumber and
main course.
electrician.
Yeah, of course. In this plumbers, electricians, all will come under this uh, facilities engineering. Okay. Apart from this, we can also take some people also. Those are sanitary
Dietitian.
workers. Yeah,
Dietitian.
of course.
Housekeeping, sir.
That is, yeah. These people, yeah, housekeeping and the sanitary workers also play a very critical and important role in hospital healthcare management. Okay, without them also, we can't able to give a proper hygienic healthcare to people. Okay, so even the sanitary workers also comes under a healthcare team in a hospital setup. Okay, so and again, in this we are going to see even a this facility engineers. So they play a major role. You can see. So there are many sophisticated instruments and equipments are there which will be handled in hospitals to have to provide a good healthcare to the people. So here, so in order to maintain this and in order to facilitate this and in order to maintain and to have a proper usage without any problem, so sure we need a proper installation and also a proper maintenance and precautionary maintenance in order to have a proper to give a proper healthcare. So for that reason only, we need this engineering team called as a facilities engineering. So earlier it was only called as a plant engineering because just a plant construction work will get over and then certain people will later will get they will have give a maintenance. But what happened later because of a very good improvement in the healthcare profession and also for because of many other diagnostic equipments, instruments, and other healthcare equipments. What happens? Many sophisticated equipments have came. So because of that, from 1990s, what happened? There evolved a separate department called as a facilities engineering from the plant engineering. Okay, so what is a facility engineering? So facility engineering engineers are responsible for planning, implementing, and maintaining the infrastructure and equipment of building and facilities. So means not only for construction of a building and also the equipment, that they will have a proper planning, implementing, and also maintaining throughout the lifetime to give a good healthcare. So that is the use of a facilities engineering. Simple terms, the all facilities should be properly installed and maintained and should be useful for a people for good healthcare. So that is the work of to facilitate this. There will be a team called as a facilities engineering, where this plumbing activity and all electrical activity and all activities will be carried out by this facilities engineering team or facility engineers. So what is the importance of this facility engineers? What will happen if there is no proper maintenance or not there is no proper installation? If you take, see, these are the glimpses that issues have came in the last 5-6 years because of some power cuts. You can see that power failure in Puducherry hospital kills 3 people who are there in a dialysis. So during the dialysis, power cut was there, and because of that, what happened? 3 people died. And again, because of because of power cuts, and the people who are there in ventilator support was died. And again, because of a gas cut. Okay, so during the to the patient, the oxygen supply was got cut. So because of that, people were died. So for this proper maintenance, okay, healthcare can be given. So it can be given by the can be prescribed by the doctor, and that can prescribed and instructed by means of a doctor. And again, what can we can what, I mean again this healthcare can be prescribed and instructed by means of a doctor. And again, this nurse and pharmacist can or other healthcare professionals can will follow the instruction of doctors, and we can go for providing a proper healthcare. But providing a proper healthcare, we need all required proper facilities, uninterrupted facilities, okay, and quality facilities. So that can be given only with help of facilities engineers or facilities engineering team. So that is a very much important role they play in a healthcare department. So here in hospital engineer service and installation is a very important component considered to be a lifeline for a smooth functioning of a hospital. So the engineer service can broadly be classified into civil services, and electrical services, biomedical services, and other services. So these are the importance of aspects of these services we are going to deal with this facilities engineering chapter. So again, first we'll go with the civil services. So civil services has many components, like they control or they maintain the ventilations, natural light, even building infrastructure. First and foremost is the building and infrastructure. So there is the skeleton of all. Okay, so with the proper, they will be having a proper ventilation with proper planning and infrastructure, and natural light should be there. As much of possible, you have to get a natural light. Okay, and again, even horticulture also they will be having the control. And data public health engineering, both water supply and sewage system also will be controlled by means of this civil services. So the engineering services of a healthcare facility support the delivery of patient care and help to maintain a healing and safe environment. So, and again, always this engineering service is an integral part of hospital infrastructure. Okay, they are not a separate entity. Again, as I said, even a sanitary workers and also this this engineering team and all those teams are a part and an integral part of hospital infrastructure for providing a proper a good healthcare. And again, the requirement of the healthcare design is that it facilitates high quality patient care for the most cost effective capital and recurrent cost. So means what have to be actually engineers just not a service providing. They have to plan, execute in such a way that they have to give a quality patient care at a minimal cost. So that is a very challenging issue or a strategy that they have to plan and then they have to execute. So engineering services have large contribution towards the shaping of environment of care. So the goal of environment of care is to provide a safe, functional, and supportive environment for patient, staff, and visitors. The environment of care is composed of building, equipment, and people. So it is a composition of this. Just the environmental care is given by the engineering. That it's nothing but it's a composition of this building, equipment, and people, where they come because of the equipments, other things, they got benefited, and they get people get good healthcare, and they leave the place. So in order to have a smooth run of these, the activities of the pharmaceutical, sorry, this facilities engineers plays a major role. So this Indian health facility guidelines gives a guidelines. Actually, they have a many parts, part A to E. So in the guidelines section, part E talks about the engineering services and environmental design in this Indian health facility guidelines. Actually, we know about the guidelines. So all there will be a regulatory bodies, and those regulatory bodies or regulatory departments, what they will do, they will give some guidelines to have a smooth run, abiding all the guidelines which they give. Okay, same way our in India we have a Indian health, Indian health facility guidance given by our health department, Ministry of Health and Family Welfare Services by central government. They give the guidelines, and this guidelines section part E talks about the engineering services and environmental design in hospitals. So they have to follow. And again, not only this facility engineers provide only the services, they also have to abide with certain laws, and then they have to go for installation or construction of building and installation and other activities. So these are the important laws which should be considered during the engineering services of all things, even building construction or plantation of any important equipments, even nuclear equipment, nuclear diagnostic equipment. So those things and all need certain laws. So those laws have to be followed, and then only it should be installed in the hospital. So that have to be taken care. So they have, just like that, they can't able to go for any planning. So they have also have to refer the laws. So as per the laws, they have to go for all their activity. So these are the important laws that governs the commissioning of hospitals. Okay. Next, excuse me, I'm audible. It's going well. Anyone?
Yes, sir. Both AV is good.
Yeah, thank
Audible,
you, thank
sir.
you.
Slides are
Yeah,
clear.
thank you. Okay, thank you. So if you take the key working areas of for facility engineering services, it requires safe, reliable, and efficient operation of building. First and foremost, that's the building. It should be safe, reliable, and should be efficient. And they're using energy as per the code of laws and regulations given by the competent authority or the regulatory bodies of that particular country. And they will be involving in troubleshooting that engineering theories, and with the help of engineering theories and principles, they will be going for some troubleshooting and preparation of technical reports and accommodation for solving problems. So these are their work areas of engineering services. So assistance in preparation of complaints documentation, acting as a liaison officer to outside utility services providers. So in the case, for example, if you take, if I want to, in a hospital, if I'm going to buy some equipment, so what we will do is we will be raising a URS. URS in the sense, it is a user requirement specification. So depending upon my maybe like a testing equipment or any testing instrument, so I'm going to buy an auto analyzer. So what I will do is I'll be quoting means I will be raising a URS. It's a user requirement specification that I will specify what are my requirements. See, it should be a semi analyzer or a full analyzer, so a full automatic analyzer, or how should be a sampler, how many samples per hour. So those things requirements I will be giving. So this will, for this requirement, actually this will be vetted by means of an engineering department, and they will be acting as a liaison officer with the service provider or the this utility providers. So what they will do is they will send the URS, and then after the quotation will be coming, they will quote it. After the quote, I will be again ensure that whether URS matches with this quotation and their equipment specification. So if it matches, then I'll be going for not approving. Actually, we will pass it, and based on that, the head of the department of that particular department will go for approval of that particular buying purchase of that particular equipment or instrument. Okay, so all that service. So this is the use of they will be acting as a liaison officer. And again, they participate in negotiation of services, rate structures, and legal agreements also. So, and again, they will be giving timely solutions to current evolving regulatory issues and resolving disputes with the building owners and contractors. Regularly, there will be some issues with many contract AMC will be there. Okay, annual maintenance, we'll be doing annual maintenance for certain equipments or instruments, because that will be a very sophisticated instruments or equipments which can be serviced only with the help of a particular specialized person only. So that in that case, we can't able to keep a person for that particular equipment alone per person. What we will do is, to the company will be giving a AMC, annual maintenance. So in that case, for that, if you have any issues with for resolving their problems with them, they'll be the in charge. And implementation of facility designs and construction, and setting operational and maintenance program parameters. So if you take the components of engineering services, in the engineering services, certain important components are there. That is, to maintain the civil asset and electrical supply, water supply including plumbing and fixtures, steam supply, acoustics and lighting, and piped medical gas and vacuum system, air conditioning and refrigeration system, lifts, pneumatic tubes systems, and dump waiters. Dump waiters in the sense, you can see in certain hotels even, actually, to carry instead of lift, to carry the components alone or materials alone, will be having a small trace which will lift the which will go up, I mean, to the top and below floors, not to pass the materials alone. So that will be called as a dumb waiters. Public health services and communication systems, paging and CCTV maintenance, and building management system, and workshop facilities for repair, and workshop facilities should be installed for repair and maintenance. So these are the components of engineering services in the hospitals. First, we'll go with the civil asset. So civil assets in the sense, the access which a patient have in a hospital, all the basic requirements a patient should get apart from the healthcare. Okay, apart from the healthcare facility or procedure, apart from that, what are the basic requirements a patient should get from a hospital? That should be given. That should be they have to get it continuously in a hygienic way. So to ensure that, we have to maintain the civil assets. Okay, the hospital building is a complex structure. The layout, space, circulation should conform to a national and international guidelines. Okay, so for national guidelines, as we said, we have our own regulatory bodies and medical regulatory bodies in our India. So that will be giving a guidance. Apart from that, we have international guidelines also. We can, for nothing but WHO. The WHO also gives a guidance for the proper maintenance of health facilities in the hospitals. So we have to maintain the confirm the layout, space, circulation as per the national and international guidelines, and the form of the building should follow function. I mean, that means during the planning itself, the building should be in such a way that the flow of the patient flow or the building structure flow should be in a proper functional way. For example, what we have to do, first thing we have to have in the entrance should be a reception. Okay, we can't able to keep a reception in other part of the building, okay, or other side of the building. So the entry should be a reception or a help desk, followed by, after reception, there should be a registration. Okay, followed by there should be a OP screening, and followed by there should be a medical department and a laboratory, and followed by, so there should be a flow should be there. So because of that flow, the patient, even the building will be like a functional building. Okay, so that should be very important. So the design and construction of the building should be environmental sustainable. Means maybe for earthquake or for a cyclone, it should be environmental sustainable, and it should provide a safe, patient-friendly, and healing environment. The design should be evidence-based. So if you take the maintenance of civil assets, the key result areas for facility engineering services in civil assets, it's have a building operation and maintenance, landscaping, that is converting a area into a more appreciable way, and electrical maintenance, lift maintenance, ground maintenance, and carpenting, painting should be proper, and the repair of non-medical equipments, and signage, preventive and corrective maintenance should be there, and equipment there should be, in civil asset there should be equipment control and pre-acceptance evaluations. That is, whenever the equipment comes, we have to go for a pre-acceptance evaluation. That we said after we said that we are going to purchase a equipment, so it comes, our instrument is going. We got the code. We confirmed our specification and the code, their specification, and our URS matches, and we ensured and we given a clearance to the department. So department, what they did is they went for purchasing the instrument. So after the arrival of the instrument, the engineering department have to uh, pre-acceptance. We have to go for pre-acceptance evaluation. Okay, so that we will ensure the working of this instrument, and then we'll be sending it to the particular department. So, and again, equipment and instrument evaluation and electrical system, including equipment, machinery, lighting, and emergency generators, and firefighting methods and devices will be maintained by the engineering department, the civil assets. Okay. So again, maintaining physical environment of hospital is also important aspect of a civil asset maintenance. That is a maximum availability of daylight and light control in a patient rest area. Actually, we have to plan such a way that the maximum daylight should be available in all places. Okay, and again, there should be a good light control in the patient rest area, like their ward rooms or those places. There should be a proper light control should be there in order to have give a good ambience to the patient or inpatient peoples. And again, sufficient illumination in varied floor area should be there. And again, coloring also should be very soothing but bright. So it should not give a very like dark colors, and which should not be a very what to say, like a dark red or maroon or something like that. We should not give a very dark colors, which will not be more friendly to the sighty to the patients. Okay, so that will even change. They will change the mood even. And again, noise should be avoided in the hospitals, and so there should be aware and all. There should be a soundproof. We have to give a proper soundproofing. And again, soothing low volume music should be installed, not high volume music. In case for not the waiting halls and in the waiting places, so we can go for installing music, but with the low volumes. And again, importantly, temperature should be maintained in a comfort level of about 22 to 32 degrees centigrade. The patient who comes from a very hot climate inside, so it should comfort him to have comfort him, so that he should feel himself comfort during the from diagnosis to treatment. Okay, so these are the important civil assets to be maintained by the facility engineering in the hospitals. Next comes the important electrical services. So actually, in order to run for everything, this power is very, very important. So electrical is electrical energy using as energy for all the from lighting to for running all the equipments. We need the electricity. The electricity is a vital to hospital operation and patient safety even. Okay, so electrical services shall be included. So we can, depending upon the requirement of electricity, we can classify the electrical services into 4 types. That is normal, vital, instantaneous, and uninterrupted. Okay, or uninterruptible. Okay, so it means what is the thing is actually electrical services can be classified into 4 types or divided into 4 types that based on their time of lapse. Okay, it means normal, vital, instantaneous, and uninterruptible. Okay, means normal in the sense, actually as per in our home, normal powers will be there. So this called as a normal power. So next is a vital. So vital in the sense, the places where we have to give a vital power, important power. So power supply should be there. There will be called as a vital powers, where there can be a cutoff of about a 30 seconds cutoff can be there. Next is instantaneous or uninterruptible, and or uninterruptible. Instantaneous in the means there can be only a 1 second changeover, and again uninterruptible in the sense there should not be break at all. Okay, for example, if you're going to have already we saw in the earliest slides. So because of interruption in the power supply, what happens? Dialysis patient died, or ventilator patients were died. Okay, so where during in the operation theaters, dialysis rooms, and in ICUs, in other places where we have a vital instruments and equipments or any vital operations going on, there should be only a uninterruptible electrical power supply should be there, because there should not be any interruption. Okay, so the proper arrangement should be made where there should not be, that UPS should be maintained, so that there should not be any uninterruptible or interruptible power supply should not be there. Okay, so for that, proper maintenance should be there. Okay, so, and again, switchgear and circuit protections to safety operate and control their supply should be there. So for that reason, we'll be using switch gears and circuit protections. So generally, energy used in hospitals, in the buildings, actually energy most for all the operations inside. Operation in the sense, operation of light or equipments or everything. For all the operations inside the hospital building, we need the energy. So the main energy which can be feasibly we can get it is called as, will be the electrical energy. Apart from that, we can go for solar energy or a fuel energy. Okay, like diesels or petrols we can use. Okay, so diesels and petrols we use only in certain places, and that too whenever there is a power cut, for generator in that place we'll be using this fuel energy. And sometimes we can go for using a natural gas in the sense for cooking other purpose, we can go for using a natural gas. Okay, so more major energy which is used in a hospital building will be a electrical energy only, that's a electricity. Okay, so it will be of about a 10 kilowatts. So so here with help of a step up transformer, what we'll do is it will convert it into a 380 volt. So here what happened, we can see in electricity energy. So these are the HVAC unit, humidity, ventilation, air control unit, and domestic hot water, lighting and plugins, elevators, and for all those things we are using only the electricity energy. And even for cooking also, we can go for using electrical energy. So hot mean the solar water can be used only for cooking or laundry purposes, and again natural gas can be used only for cooking purposes. Okay, so these are the energy. So the electricity or electrical supply plays a major role in operation of all major activities within the hospital building. So this is the energy breakdown structure diagram, which shows the consumption of electrical energy in different areas or different different portions. Means like medical equipments or HVAC units for cleaning air, or domestic hot water and lighting plugins. So these are the energy breakdown structure diagram for usage of electrical energy within the industry. Sorry, hospital. Okay. So generally, hospital loads can be classified into essential and non-essential. Okay, essential in the sense where very vital. We saw na, depending upon the cutoff, depending on the cutoff, that 30 seconds or once uninterruptible. So those things and all will come under essential, and non-essential. Essential in the sense like laundry area or other area will becomes under a non-essential area, where the interruption of power supply will not be a problem. So in case also, for example, what happens, there is a power shutdown because of some cyclone or because of some other flood issue, there is a major shutdown in power. Okay, so the hospital should divide the whole power supply into essential and non-essential. So what will happen, we have to give supply only for the essential, because sometimes we need for a 3 days power backup may be needed. For in that case, we'll be using a fuel energy. So in that case, we should not go for wastage of electrical supply for non-essential areas also, because in order to maintain or how to have a rational power supply usage, we'll be giving only for essential areas like operation theaters and other healthcare providing areas. Okay, for other non-essential areas like this laundry area or cooking area, and those places we can go for avoiding the we can go for giving the non-essential power lines, so that what we can do is we can cut the non-essential power lines, and we can ensure that always we have a proper power supply to the essential area. So for that reason, we will divide the power supply into essential and non-essential area. Okay, and hospital distribution system likely to should have this additional power supplies. Okay, like generators or the other power backup should be there in order to maintain the power cuts, in order to manage the power cuts, and to standby diesel engine driven generator set supply should be there, and emergency battery supply should be there, and uninterrupted power supply system should be there. Importantly, to the operation theaters and dialysis units, and most important vital ICUs, ventilators, and those areas, there should be a uninterrupted power supply system should be there. And earthing as per the requirement should be ensured to emit, because in case of a high voltage current is coming, so in order to discharge the extra energy, without harming the person or even the equipment. Okay, so that there should be a proper earthing should be there, or else the extra power will not be dissipated out, and that may damage the equipment or sometimes even the person who is there under the damage, I mean equipment control. So should avoid the physical and mechanical pressure on the cable. So where so cable should be laid on trays to avoid the direct pressure. So even in tape, I mean this cables can be either underground or it may be on the on surface, okay, or near the roof or ceiling. Okay, so wherever we place, if it is underground, so our this the material which over there or a ground or then nothing should have a pressure over the cables so that the cable should not be damaged. Okay, so even though if you're going to keep over near the ceiling, in that case also we should avoid the direct pressure over it. So we have to go for a keeping a proper placing in a proper tray or in a casing. Okay, so joints and terminals must be tightly secured and sealed to avoid the heating and sparkling. And again, loose connections plug must be regularly repaired, and do not use bare wires into a socket. Never should be used a bare wires into the socket. So that is a neglects electrical hazards. So ensure a proper earthing of all equipments. Heating appliances, lights, fans, and air conditioners to be switched off whenever not in use. You have to have a proper power to save the power. And to power grid junction boxes, generators must be regularly inspected and maintained. We should use UPS and voltage stabilizer to ensure constant supply to the sensitive gadgets or places. And there should not be any loose or hanging wires present in the hospital area. Okay, so in case if you're going to have a high voltage installation, so in high voltage we'll be having a high voltage transformers and switch gears, and it should be either be housed in a building or structures remote from the patient area or be located in a fire isolated part of the main building. It should not be kept within the building complex. It should be in the complex. We can keep. We should not be keep inside the patient areas. It should be kept only outside the patient reach or patient area, in an isolated part of the building or that compound. So not to have a for the safer for the safety purposes. Okay, for that for those areas only should be accessible to the authorized persons only, and again provided with the instantaneous lighting served with from the vital electrical supply, and provided with the instantaneous power to control switching served from the vital electrical supply. So these are recommended for high voltage providing. So next, in case of you take your cabling, already we saw that cabling should be kept in a trays or in a casing, not to avoid the extra pressure from outside, not to avoid the damage in the wires. Okay, and apart from that, again, cabling should have a 25% space capacity above the calculated maximum demand. So in the trays, we should not be get congested. Okay, if you have a plan of as per the area, 25% spare capacity should be left free, to avoid the over congestion in the wires, to avoid the damage in the wires. Okay, so even if you have a damage in the wires, that may lead to a power cut, and it may be a problem. And cabling shall be located so as not interfere with the medical equipment sensitive to magnetic fields, like MRI and those equipments should not be kept. And again, cabling carrying heavy loads should not be located adjacent to the ICU or operation theaters and similar areas where cardiograph monitoring equipments is to be operated. So the heavy loads should be away from those important areas, so that the heavy loads should not come near this ITUs and OTs where we have electrocardiograph equipment, monitoring equipments. So these are about the electrical power supply in the or electrical management in the hospitals. Next comes with the water supply. So generally, water is a very important need for the patient or for a life even. So same way, water supply is also very important, vital part in hospitals. So hospital water requirements, if you take, it requires about 450 liters per bed per day actually. Okay, for all, including bathing and for everything, washing and everything, it requires about 450 liters per bed per day. And again, centralized water pump will be used and located. It should be located half a feet away from the sewage line. Always the sewage line should be at least it should be away from the this water pumps in order to avoid the contamination. And it should be a requirement of, if you take a requirement, 400 to 650 liters per day per bed per day it's required. Okay, minimum 400, maximum 650 liters will be required per day for a bed. Okay, so again, if you take the source of water, we can generally we'll be using a municipal water. Municipal water in the sense the water which is given by the government, or the water which is supplied by means of a local municipal, that is a competent authority of that particular area. So that will be called as a municipal supply water. So that can be used, or we can go for using a generally we'll be saying about water. If you take a water, there is a two types of water. Actually, the water source, only two types of water source are there. One is a surface water, and is underground water. Surface water in the sense all river water, lake, pond, those waters will be called as a surface water. The water which is taken from underground will be called as a groundwater. Okay, only surface water and groundwater are there. So mostly we can go for using the groundwater. We can procure groundwater from outside, and then we can go for treatmenting it, and then we can go for using it, or else we can go for using a tube well. I mean groundwater with help of a tube well. Okay, so this is a source of water. And again, if you take a storage, at least we have to store a 2 days requirement. We should be stored in our hospitals. Okay, either storage can be underground or a overhead. Generally it will be, I mean, in the case of municipal water, it will be taken to underground some, and then it will be shifted to overhead capacity. Okay, in the top. Okay, or else even if you're going to use a outside sourced water from even we can take lake water or something, so we are going to take, so we can take it from this we can transport it to with help of lorries, and then truck, and then what we can do is we can transfer it inside, and then we can purify it, then it can be taken to overhead tank, and then can be used. Okay, this is a water, I mean this is a source of water. And again they should have a proper distribution network should be there. And again for a potable water, there should be a proper filtration system should be inside the hospitals to have a potable water, in the sense drinking water will be called as a potable water. So even though we are going to receive it from outside, or we're going to, even if we take from a municipal water as a supply, we have to go for a proper filtering unit in order to have a potable water. So regarding the filtering, we have a very good method called as a reverse osmosis. Regarding that, we will see in the last slide. Okay, so here in RO plant again. So RO plant should be installed, RO in the sense nothing but reverse osmosis plant. If installed for a it should be if installed, we have to know about their purifying capacity. So depending on that, we have to go for a maintaining it and changing the this membrane filters inside. Okay, and again proper covering provisions to be in a storage tank should be given, and overflow of water from fire compartment should be avoided. And again functional planning requirements should be there, and pump rooms should be placed in order to have a proper pumping, in order to have a proper flow of water and have a proper water supply throughout the hospitals. So again always we have to go for a water analysis. So we have to go for checking the water analysis report to find out the quality of the water. And again, like physical characteristics, chemical characteristics, and biological qualities. Physical characteristics in the sense its hardness, and those things will become under physical characteristics. And if you take a chemical characteristics, the dissolved ions and dissolved gases limits, and those things will come under and the electrolytes present. So those things will become under a chemical characteristics. Okay, and bacteriological qualities in the sense the presence of pyrogen or bacterial colony, see a few amount of bacterial load in the water, and again presence or absence of pyrogen, and those things will come under a this bacteriological qualities. So these all should be checked, and have regularly it should be checked the water which we are used in the hospital. And final statement about the water fitness should be given. And pipes, and always the pipes which are used for water supply should be made up of iron, that is a galvanized iron. So because iron water will will rust the iron, so that we have to go for a galvanized iron to avoid the rusting. Okay, and we can go for, or else we can go for a PVC pipes, that is a polyvinyl chloride pipes for the water supplies. So where there will not be any corrosion, or there will not be any rusting problems will not be there while using the PVC pipes. So it will be more robust for usage. So generally in the actually regarding when we see about a source of water, we have seen about the two sources. One will be a underground water, another will be a surface water, another will be a groundwater. Okay, so apart from this, generally we have many types of water. So like mineral water, distilled water, many things are there. So in pharmaceutical usage, in a hospital, a pharmaceutical usage, if you take generally in pharmaceuticals, what we do is we used to say, or even US pharmacopoeia, sorry, Indian pharmacopoeia or any other pharmacopoeia, we have three, even Indian pharmacopoeia, we have three types of water, called as a potable water, purified water, and third is a water for injection, and also say it as a sterile water for injection. Okay, so the only three waters are there. So here, if you take within a single system, within a single method, we can't able to go for a preparation of a particular water. So potable water, already we said, potable water is the water which is approved by the competent authority for the usage of a human purpose in that particular locality. It will be called as a potable water. So means if you take in the area, there will be the municipality will be the competent authority of that particular area. So they will approve some water for a human usage. So those waters can be used for drinking or other purposes. So that water will be called as a potable water. So potable water should not be used directly for any medical purposes, because it will not be having a large quantity of dissolved substances or other substances. Even biological loads will be more in the potable water. Okay, so we should not go for using this potable water for any medical purposes or medical usage or hospital purposes. Only for drinking we can use. Even the drinking also, it should be properly, proper filtration setup should be so maintained in the hospital for drinking water. Potable water directly should not be used for even drinking also within the hospitals. Okay, after proper filtration, it should be used by the patient. And again, if you take this okay, what is meant by purified water, water for injection? In the sense, say what there's only a specification. There's no any proper, they doesn't say strictly about the methods. So this particular method will not give you a purified water. Purified water in the sense, it should be away, I mean it should be free from electrolytes, free from dissolved substances. All electrolytes should be removed, and all particulate matter should be removed, and all dissolved substance should be removed. So, and it should have a minimal conductivity. Actually, water is not a good conductor. Okay, only the water is have only minimal conductivity. Because of the dissolved substances and electrolytes present in the water, water has a more conductivity. If you take a complete pure water, the conductivity will be very less. Okay, minimal, because of only this hydrogen and hydronium ions, it will have some conductivity. Okay, and apart from the conductivity will be very less. So if you take normal water, if you take salt water, salt water conductivity will be very more, because it have NaCl, electrolyte. So because of this electrolytes, will have a higher conductivity. So when compared to normal water, salt water, that's sea water will be having a more conductivity. So normal water will be having a, compared to sea water, normal water will be having a less conductivity, and compared to this normal water, purified water will be have a very minimal conductivity, because the minimum that we will be removing all the electrolytes. So the like this, the pharmacopoeia or any specification, any standard regulatory bodies, or what they give us, only they give us specification for the water. So the water should have this much amount of conductivity, this much amount of dissolved substances, this much amount of dissolved gases. So in order to achieve that, we have to go for a number of processing, a number of methods of processing to bring out this particular water, purified water, or water for injection. Okay, so what we have to do is, initially, if you're going to have a underground water, or it may be a so from a lake or some other, even those waters, okay, we are procuring from outside, whatever may be. So it will be having a lot of particulate matters. Particulate matters in the sense there will be a large particles will be there, like mud, sand, any other materials also will be there. What we'll do is, first we'll be going for a first coarse filtering. Coarse filter will be there. Coarse in the sense big. So that big filter will be having a big pores, so that the only the larger particles will be, what will happen, will be removed off. Okay, after removing the larger particles, what we will do is, we will pass it to the ion resins. The resins will be containing the cations and anions. So cationic resins and anionic resins will be there. So will be passed, and third will be the mixed ions. So after by passing those cationic ions and anionic cationic resin and anionic resin, what happens? Those ionic materials present in the this all the water will be completely removed, and even after removing the anions and cations in the water, so some amount of ions also will be present in it. Okay, so in order to remove that, what we will do is the remaining amount of ions have to be also removed. Meager amount will be there. In order to remove that, again we will simply through a mixed resin. Okay, where there will be both cationic resin and anionic resin. It will remove both cations and anions present in the water. So after removal of ions, what we will do is we will pass it through the this membrane filter. So membrane filter, what we'll do is even minute particles will be there, some bacteria will be there. So like 0.3 micrometer size will be there, membrane filter. So we'll pass through the water through it, and we will filter all the microbes present or minute particles, microparticles present in the water. So after removing it, what we will do is we will pass it through reverse osmosis method, reverse osmosis, where we will be filtering all the materials, and after which we will be passing it to the distillation, and then after distillation the water will come out, that will be called as a purified water. Only if it comes from the out of distilled water, it will be called as a distilled water. Sorry, only if it passes through the distillation unit and comes, called as a distilled water. Only if it passes through the RO and comes, it calls as a reverse osmosis water. Okay, so here when it passes all, when we are going to processing the water with all these process parameters or processing methods, the end product will be called as a end product will be tested out. Okay, so sure, it will comply the specification. That is there will not be any dissolved ions or dissolved gases, dissolved metals will not be there, and so it will pass the specific. So sorry, 1 minute. Okay, sorry. So that will be called as a purified water. So actually the thing is that point is that, so we can't able to bring a purified water within a single method. Okay, it have to be processed with help of many methods, and finally only we can go for getting a purified water. Okay, so here in that we have seen membrane filters normal method. We will be placing a membrane filter, and then what we will do is we will pass the water, and the other side will be after filtering the filter will have a the particles which is about less than 0.3 micrometer will be completely removed, and we will be getting it. Okay, and generally very important method of removing all the dissolved substances will be called as a reverse osmosis method. Okay, RO water purification. Even for drinking also, even in a domestic purpose also, we'll be using a RO. This reverse osmosis filtration method will be used for a filtering or purification of water. Okay, this is a very efficient method. So in this reverse osmosis, just we will say just basic principle. Actually, in the reverse osmosis, if you take osmosis is nothing but a movement of solvent molecules. Generally what will happen, always a solute only will move from a higher concentration side towards the lower concentration side. Okay, always it's a passive movement. Okay, it need not have any extra energy. What happens, the the substance from a higher, the solute from the higher concentration side will move towards the lower concentration side. This is called as a osmosis. Okay, sorry, it's normal passive method. What happens, I'm going to keep a filter membrane in between the two different concentration. From higher concentration, there is a two different concentration. One side is a higher concentration, other is a lower concentration. What I'm going to do is I'm going to keep a membrane in between. Okay, that is called as a semi-permeable membrane. Okay, so semi-permeable in the sense permeable means it will permit. Okay, semi-permeable means it can partially permit. Means what is the meaning is it can pass the pore size of the semi-permeable membrane will be very small in such a way that it can pass only the solvent molecules, not the solid molecules. We know solid molecules will be less higher than that of a solvent molecules. So it can pass only the solvent molecules, not the solute molecules. Okay, so what I'm going to do is I'm going to, you can see here in this 1 minute. You can see here in this blue color, we can see in this blue color. So it's a high concentration, it's a low concentration. This is a low concentration. Okay, so I'm in between the green color, we shows that it's a semi-permeable membrane. Okay, what happens actually whenever when you keep this actually, if there is not a semi-permeable membrane, normal filter paper is there, filter is there, what will happen? The solute, both the side concentration should be equalized. So what will happen? The liquid from the solute from the higher concentration side will go towards the lower concentration side, so that it will get equalized. Okay, but here the thing is that what happens, we kept a semi-permeable membrane, so the solute can't able to move, only solvent can move. So what happens in this case? Only the but here the concentration should be equalized. So not the concentration should be equalized. Okay, from here solid can't able to move. What happens? Solvent from a lower concentration side moves towards the higher concentration side, so that the concentration will be equalized. Okay, so this movement is called as a osmotic movement. The movement of solvent molecules from the lower concentration side towards the higher concentration side will be called as a osmosis. Okay, so while moving it will exert a pressure over the membrane, so it's called as osmotic pressure. Okay, so this is a normal process. Okay, so what I'm going to do is here, what I'm going to do is actually I'm going to say keep a two liquids. Okay, two liquids I'm going to keep. So again what I'm going to do is again I'm going to keep a semi-permeable membrane in between. Okay, after semi-permeable membrane in between, after keeping this, what I'm going to do is actually if I keep this, immediately what happens, this higher concentration side, this is a lower concentration side. What happens? The solvent from lower concentration side will move towards the higher concentration side. That is the normal in osmosis because of the semi-permeable membrane. Okay, but what I'm going to do is I'm going to put a pressure over the higher concentration side. Because of this pressure, what happens? The liquid can't able to move from the lower to higher. It can't able to move. Okay, what happens? Because of this pressure, the solvent from higher concentration will move towards the lower concentration side. Okay, so with this, how the water get purified? Here we are going to take this higher concentration in the sense, we have a higher concentration in the sense, we have a unpure water. See, this is a unpure water. So what happens? This unpure, because of this dissolved substances, other substances, the concentration is more. Concentration in the sense nothing but solute is more. The water solute in the sense the undissolved, dissolved substances, other impurity inside the water will be called as a dissolved substances. Okay, so this it is there. So it's a higher concentration side. So pure water we have kept little. So it is called as a this is a low concentration side. Okay, so what I'm going to do is actually I'm going to place a semi-permeable membrane in between. Okay, semi-permeable membrane in between I'm placing. Okay, so if I'm placing this semi-permeable membrane in between, what happens here? Now the solvent from this lower concentration side, that is a from pure water, it can't move towards the impure water. Okay, so what happened? I'm going to place a pressure in the higher concentration side, that is a impure water side or raw water side. Okay, so what happens? Because of this pressure, what will happen? The solvent from here, impure water, that is a pure water alone, move towards the lower concentration side, that is a pure water side. Okay, so what happens? Only we'll be receiving the pure water because of the reverse osmosis. Actually, when this happens, this is called as a, when this happens, this is called as a, when this comes, that's a, from a lower to higher, if it goes from a solvent from lower to higher, it goes, it's called as a osmosis. As I'm, because of this I'm applied pressure, I'm reversing the solvent movement, reverse osmosis. So same way I'm reversing from higher concentration side, that's a impure, from impure water I'm making the, giving a pressure and making the water around to move towards the pure side, and I'm getting the pure water. It is called as a reverse osmosis method. So this is the efficient method by which we'll be going for getting the this pure water. Okay, so with this help of this, we can go for getting the pure water. Even because of this membrane filter, we can go for removing the microbes present. Everything okay. Even we can go for with help of UV treatment. We can go for steriling the preparation water. Everything is okay. But thing is that sorry, but but we have a problem called as a pyrogen. Okay, we said water for injection. Okay, so even for OT purposes or rinsing purposes, cleaning the being a tissue cleaning during the operation everywhere, we have to go for using only the water for injection or a complete purified water or sterile water for injection. Okay, what's the difference between a purified water and water for injection? So water for injection is nothing but it will be sterile. It will be having all the property of water. Along with it, it should be pyrogen free. Pyrogen means pyro means temperature. Okay, pyrogen means the substance which will increase the body temperature will be called as a pyrogen. Okay, so which substance will increase the body temperature? Something which enters into our body, that substance will that have the capacity to increase the body temperature will be called as a pyrogen. So in our body, so some bacterial endotoxin. Okay, pyrogen is nothing but the substance which increase the body temperature. So generally pyrogens are nothing but bacterial endotoxin. It's not a living bacteria, it is a bacterial endotoxin, the toxin which was excreted by means of a bacteria, especially gram negative bacteria like E. coli. Those bacteria will liberate or will lead this that will liberate toxins. So those toxins will be called as a bacterial endotoxins will be called as a pyrogens, and it's a chemical lipopolysaccharide. What happens? So all other methods we can filter the microbe or we can kill the microbe. Okay, so with all this filtration method and again ion resins will remove the ions only, and again even reverse osmosis have the ability to remove the microbes even. Okay, so but pyrogen can't be removed. Why pyrogen can't be removed? Pyrogen is not a microorganism. It's a dissolved substance. It's a lipopolysaccharide. It's a very good, can be very well dissolved in water. So even during the reverse osmosis method, it can be easily comes to the other way. Okay, it's not a solute molecule, so it can easily pass through the even reverse semi-permeable membrane can easily cross through. So it is very difficult for removing the pyrogen. Okay, so what if pyrogen present in the water? So in case if there's the OT operation is there, so bypass surgery, any surgery is there, so there will be a lot of washing and water will be used. Okay, so for those water we have to use only the water for injections. Okay, so always you can see for rinsing the wound and even for any minor surgery also they will be using only the dextrose water or dextrose infusions they will be using, or they will be using a water for injection itself will comes under in a 500 ml pack. That will be they will be using because it's a pyrogen free. So in case if I'm going to if the water which I'm going to use, if there's a pyrogen, what will happen? So it can directly enter into the body, so it will increase the body temperature. Already the patient is in a problem, so only some operations are going on, already he is in a critical care. So in case if his body temperature increases again, the managing him will be a very challenging. So now to avoid the increase in body temperature, we have to use only the apyrogenic water. For and all methods, with help of all methods, we can go for removing the bacteria or other things. The only method which will be used to remove the pyrogen will be called as a distillation method. You know, distillation is nothing but what we will do is, in order to purify the water, what we'll do is we'll boil the water, and what we'll do is the vapors, in boiling vapors will be formed. In vapor there will be only water will be there, because dissolved substance will not go in the vapor. Okay, because of that temperature only water will get vaporized. So water will go as a vapor. We'll have a condenser, we will condense it, and the condensate will be taken as a distilled water. Okay, so same way we'll be using a series of distillation. You can see here. Okay, you can see here, sorry, you can see here series of distillation units are there. Okay, 1 2 3 5 5 are there. So first one, there will be a distillation will be taking place. What happens here? Water will boil, it will come up, and the only vapors will come to the other distillation unit. From here again this water will condense, and from here again it will boil, it will come, only water vapors will come to the other distillation unit. Okay, why we have a series of unit? Because here it is boils. Okay, while boiling also when vapors are lifting up, okay, when vapors are rising up, sometimes small droplets can entrain along with the this vapors and can come along with the vapors. Okay, so within a single distillation, we can't able to remove the pyrogen completely. Sometimes that small droplet, the pyrogen may come. So what we will do is, when you're going to have a series of distillation, so here in first, even though in first there's a small droplet entrained and came, in second it may remove. Even if it's not removed in second, in third it may remove. So I'm going to have a series of distillation. In fifth one, after distillation out from the fifth one, we'll be getting a complete pyrogen free water. Okay, so these are the, so that is the use of a distillation unit. So by means of a series of method, only we can go for a getting a this purified water or water for injection for a medical purposes, and even other methods for filtration will be using reverse osmosis to have even a potable water or drinking water inside the hospital facility. So this is about the water facilities maintenance in a facility engineering. So with this, we will conclude today. So if there's any doubt, please. Anybody there?
No, sir. Thank you, sir.
Hello? Is it there is any doubt? Please.
No doubt, sir. Clear, sir. Thank you, sir.
Okay. Okay. Thank you. Thank you, sir.